First of all, Madam Clerk, perhaps you can explain under the electronic meeting process, maybe there's some points you'd want to make clear so that things sail as smoothly as can be this morning. Please proceed.
Good morning. I'm going to briefly review the rules and protocols for electronic participation in this regular Region of Peel Council meeting. During these meetings, we continue to comply with provincial orders and public health orders and recommendations to support social distancing, as well as prohibiting public gatherings of more than 5 people. To that end, this meeting is being streamed live from the Region of Peel website, and we encourage the public to stay home in accordance with provincial and public health recommendations and listen to the proceedings from there. We are screening all those that are here in person. Further, we have purposely spaced people in the chambers more than 2 meters from each other to maintain a physical distance. The people present in chambers are Chair Yanika, myself, and clerk staff sufficient to facilitate the technology and procedures for this meeting. There will be no more than 5 persons in the chamber throughout the meeting. We are conducting this meeting using Skype. For an optimum Skype experience, we ask those that are joining by Skype to please take the following measures to avoid feedback and confusion with members speaking over one another. Please keep your microphone muted unless you have the floor to speak. Please use a headset and avoid using hands-free devices or speakers. Please speak loudly and clearly when you have the floor. Please ensure that any surrounding environmental noise such as television, radios, and pets is eliminated. We have technical staff standing by to assist with today's electronic participation. Thanks for all the technical staff at the cities of Brampton and Mississauga who are also standing by to provide assistance to their respective councillors. Each of the municipalities have different platforms and devices, and bringing them all together for a single meeting is a challenge, but our collective technical staff have done an excellent job pulling it all together. Having said that, if you do experience difficulties during the meeting, please send an email to council@peelregion.ca with your issue and a phone number that a technician can call you and respond to your issue. The email will be monitored throughout the meeting. Those that are participating electronically will see the regional logo on your screens, as we have not activated the chamber cameras for this meeting. However, during staff presentations, the slides will be visible on your screen. In response to the request to be able to see one another, for those Skype attendees, you may activate your video while you are speaking. Please take a look at your screens as we are putting up a picture of the button you use to activate your video. Should you wish to enable your video, you may do so by clicking on the video camera icon located next to the microphone icon and then clicking Start My Video. Your video is not being recorded as only audio is being live streamed and recorded. When you have finished speaking, please turn off your video. Clerk staff will be toggling between the meeting participation feed and other AV feeds based on the meeting needs, including the presentation screen, so both cannot be activated simultaneously. If you don't want to activate the video feed, you are not required to. We will still hear you, just not see you. Those participating electronically will not have access to the usual request to speak button. If you wish to speak, please send an email to council@peelregion.ca and you will be added to a speakers list in the order of receipt of the emails. When you are called upon, please unmute your speaker and proceed. When you have concluded your comment or question, please mute your speaker. If you ask a question, the chair will call upon the most appropriate person to respond. After the response, the chair will circle back to you for any follow-up and to confirm that you have yielded the floor. If you have any motions or amendments to introduce regarding today's business on the agenda, please email your motion to council@peelregion.ca, identifying yourself as the mover and also identifying the seconder of your motion. If you do not have a seconder, the chair will call for a seconder. If you wish to second the motion, please send an email to council@peelregion.ca. and the first email received will be deemed to be the seconder. Each motion will be read in its entirety prior to calling a vote. Voting will be conducted verbally. For procedural votes that do not require a recorded vote, I will call for any objections. If you have an objection, please unmute your microphone and indicate your name and objection. If no objections are stated, the motion will be deemed to be adopted. For recorded votes, I will call upon each member in alphabetical order based on last name. Once called upon, please unmute your microphone and indicate your yes or no vote. I will confirm the vote of each member. This process will take some time, so please have patience. If you do not respond when called upon to vote, I will call your name a second time. If you do not respond to the second call, you will be recorded as abstaining from the vote, and your vote will count in the negative as a nay vote. I will be calling roll call. Please indicate your presence by responding here when called upon. If you are leaving the meeting, please send an email to council@peelregion.ca to indicate that you are leaving the meeting. If you have left the meeting for any votes thereafter, you will be marked absent. If you don't advise that you are leaving the meeting and you don't respond when called upon to vote, you will be considered to be abstaining, and a vote will be recorded in the negative as a nay vote. It is very important that you advise if you're leaving the meeting. If the meeting should move into closed session, those members who are participating remotely must ensure that no other person is in the location from which you are taking part in the meeting, or make appropriate arrangements so that any other persons cannot see or hear any of the confidential deliberations taking place. If that is not possible, the member must withdraw from the meeting until it is moved back into public session. Prior to moving into a closed session, members shall declare that they adhere to the confidentiality standards as outlined in the Regional Council Code of Conduct. At the last meeting, which was our first attempt at a meeting with electronic participation, there was some frustration with being kicked off the meeting. If your device runs out of battery, you will be logged off the meeting. If your device goes to sleep, you may be logged off the meeting. Please keep your device charged and awake to assist with connectivity. If you do drop off the meeting, please re-log on, and if you have difficulties, please send an email to council@peelregion.ca, and we are here to assist. Those are a lot of instructions. If you have any questions, we can please send them to council@peelregion.ca, and we will address them. We will now commence the meeting with roll call.
Madam Clerk? Madam Clerk, if you would proceed to take the roll call.
Thank you. Mayor Brown?
I'm here.
Thank you. Councillor Carlson?
I'm here.
Thank you. Mayor Crombie?
I'm here.
Thank you. Councillor Demerla?
I'm here.
Thank you. Councillor Dasco? Councillor Dasco? Thank you.
Yeah, I'm here.
Councillor Dillon?
Yes, here.
Thank you. Councillor Downey?
Present.
Thank you. Councillor Fonseca?
Here.
Thank you. Councillor Fortini?
Good morning, I'm here.
Thank you. Councillor Groves?
I am here.
Thank you. Councillor Innes?
I'm here.
Thank you. Councillor Kovac?
I'm here, thank you.
Thank you. Councillor Mahoney?
Present.
Thank you. Councillor McFadden?
Good morning, everyone. I'm here.
Thank you. Councillor Medeiros?
Here.
Thank you. Councillor Paleshi?
I'm here.
Thank you. Councillor Parrish?
Yes.
Thank you. Councillor Raz?
I am here.
Thank you. Councillor Sato?
Yes, I'm here.
Thank you. Councillor Santos?
Here.
Thank you. Councillor Sinclair?
Yes, Ian Sinclair here.
Thank you. Councillor Starr?
Present.
Thank you. Mayor Thompson? Okay, Councillor Thompson, or Mayor Thompson is having some technical issue. He has emailed that he is present. Thank you. Councillor Vicente?
Present, thank you.
Thank you. And Chair Unique is here for a full house. Thank you.
Yes, thank you. So with full attendance, we proceed. The next item I have on my list is the Indigenous Land Acknowledgement. We would like to begin by acknowledging that the land on which we gather and which the Region of Peel operates is part of the treaty lands and territory of the Mississaugas of the Credit. For thousands of years, Indigenous peoples inhabited and cared for this land. In particular, we acknowledge the territory of the Nishnabek, Huron-Wendat, Haudenosaunee, and Ojibwe Chippewa peoples. The land is also home to the Métis, and most recently, the territory of the Mississaugas of the Credit First Nation, who are direct descendants of the Mississaugas of the Credit. We are grateful to have the opportunity to work on this land, and by doing so, give our respect to its first inhabitants. The next item I have, Madam Clerk, are there any declarations of conflict of interest? Hearing none, no conflicts of interest, I go on to approval of the minutes of the agenda. Item 4.1 is the approval of the March 26, 2020 Special Regional Council meeting. If I could have a mover and a seconder.
Karen Rez can move it.
Councillor Raz has moved it. Can I have a seconder, please?
I'll second it. It's Councillor McFadden.
Seconded by Councillor McFadden. I have a mover and a seconder, and any questions or comments? If not, all those in favor, Madam Clerk? In fact, that's a very good point. We will only go by objections only, making life much simpler. So the clerk, I'll let you call that vote.
Any objections? Hearing none, that motion carries. Thank you.
Very good. The next item, 4.2, the March 26, 2020 Special Regional Council meeting as well. If I can have a mover and a seconder.
Carolyn will move it.
Thank you. Do I have a seconder?
Ian Sinclair, second.
Madam Clerk, if you would conduct the vote.
Any objections? Hearing none, the motion carries. Thank you.
Very good. And finally, item 4.3, the March 12, 2020 Regional Council meeting. Again, a mover and a seconder, please.
I'll move it.
And that is
Councillor Groves.
Councillor Groves. Do I have a thank you? Do I have a seconder?
Mahoney.
Councillor Mahoney is seconded. Madam Clerk, call the vote.
Are there any objections? Hearing none, motion carries. Thank you.
Very good. That brings me to item 5, the approval of the agenda. And Madam Clerk, you would like to speak to the amended rules under electronic procedures that we are under. Madam Clerk.
Thank you. Well, the delegations from this morning's meeting have withdrawn. We do have a non-council, non-staff person given an in-camera presentation today. The rules originally had been prepared when the public event attendance number was 50. As such, we were keeping the electronic participation to councillors and some staff, but with this change in the public event attendance to 5, we propose to change the electronic participation rules to allow delegates to participate electronically as well. We require a motion to amend the electronic participation rules to allow for delegations to participate electronically.
So moved by Vicente.
Very good. Do I have a seconder?
Palashi.
Seconded by Councillor Palesci. Madam Clerk.
And this is a recorded vote, so I will be calling your names. Mayor Brown?
Yes.
Mayor Brown in favor.
Yes.
Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
Madam Clerk, in favor. However, can I just have a point of clarification, please?
Yes.
Did you say that the 2 delegations that we were added to the agenda have withdrawn?
That is correct, and that will be dealt with at the approval of agenda, which is the next item. Councillor Demurla?
Yes.
Councillor Demurla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Downey?
Yes.
Thank you, Councillor Downey, yes. Councillor Fonseca?
Yes.
Councillor Fonseca, yes. Councillor Fortini?
Yes, please.
Councillor Fortini, yes. Councillor Groves?
Yes.
Councillor Groves, yes. Councillor Innes?
Yes.
Councillor Innes, yes. Councillor Kovac?
Yep.
Councillor Kovac, yes. Councillor Mahoney?
Yes.
Councillor Mahoney, yes. Councillor McFadden?
Yes.
Councillor McFadden, yes. Councillor Medeiros?
Yes.
Councillor Medeiros, yes. Councillor Palesci?
Yes.
Councillor Palesci, yes. Councillor Parrish?
Yes.
Councillor Parrish, yes. Councillor Raz?
Yes.
Councillor Raz, yes. Councillor Sato?
Yes.
Councillor Sato, yes. Councillor Santos?
Yes.
Councillor Santos, yes. Councillor Sinclair?
Yes.
Councillor Sinclair, yes. Councillor Starr?
Yes.
Councillor Starr, yes. Mayor Thompson? Mayor Thompson?
Yes.
Mayor Thompson, yes. Councillor Vicente?
Yes.
Councillor Vicente, yes. Thank you very much. This carries.
Thank you. So with that, we come to item 6, the consent agenda. The delegations have been dealt with as they've been withdrawn. We will deal with this. Yeah, we will have to, sorry, you want the approval of the agenda now, Madam Clerk? Oh, sorry. Very good. So I do require the formal approval of the agenda. I need a mover and a seconder, and the motion reads that delegations 7-1 and 7-2 listed on the April 9, 2020 Regional Council agenda be withdrawn, and further that the agenda for the April 9, 2020 Regional Council meeting be approved as amended. I think Mayor Crombie wanted to move that. Do I have a seconder, please?
Fortini?
Second.
Councillor Fortini has seconded. Madam Clerk, if you would take the vote.
Mr. Chair, before we do that, may I speak, because I asked to speak during approval
Please.
of the agenda?
Please go ahead, Madam.
You know, it happened to be about the delegations, but these are extraordinary times. So I'm just wondering if we could really focus on the issues that matter to keep the region functioning, particularly as they concern COVID-19 and what we need to do to get us through this pandemic and this crisis. And you know, these matters that have already been voted on are not something that I think in future we should raise and bring on the agenda again until such time as we're through this pandemic. So I know that others feel the same way. Let's focus on the business at hand. I don't want to reopen items that have been discussed. I want to focus on the pandemic and get us through these extraordinary, unprecedented times. Okay, that's what I'd like to say.
And Madam Mayor, well said, and if you'll permit me, I want to thank the delegates themselves for being honorable enough to understand that as well. So point well made.
I did the right thing. Thank you so much.
Thank you, Madam Mayor. Madam Clerk, I come back to you for the vote. Yes,
Mr. Chairman?
Yes.
It's Mayor Thompson that wants to speak to this.
please.
I do agree where Mayor Crombie's going, but I'm extremely disappointed on the decision that council made, and this is why we have the delegations when it was a report supported by council. It's unfortunately that I got it voted down, and to me, now we're in real difficult times, and silly nonsense like this that has happened has now created bigger problems. So let's learn from this going forward, please. Thank you.
Thank you, Madam Clerk. If you'd administer the vote, please.
Any objections to the approval of agenda motion? Hearing none, it carries. Thank you.
Thank you all. This brings me to item 6, the consent agenda. Items under delegations have been dealt with. We have 2 presentations from staff that we will deal with at that time. Madam Clerk, did you have a point to make here? Go ahead.
To facilitate the consent agenda item, Chair Yanika will state each item number and title in the order it appears on the Regional Council agenda. Should you wish to hold the item, please unmute your microphone, identify yourself, and state "hold." After the chair has gone through the entire agenda, he will circle back and read all of the held item numbers. If we have missed any number that you want held, please unmute your microphone, identify yourself, and state the item number you would like to hold. The chair will then proceed to call the vote on the consent agenda. It is a recorded vote, so I will be calling out the names of each of you and confirming your vote. Thank you.
Thank you. So just to be clear, everyone, as opposed to being able to see you in the room and everybody says, I only want someone or anyone or some of you to say hold on any matter you would like held. Hearing nothing, we will assume we have consent. So I start with item 9 on our agenda, items related to public works. Item 9.1, external legal counsel for the Peel Renewable Natural Gas Center project, document number 2016-227N. That is held. Item 9.2, Locate Alliance Consortium update. That is on consent. Item 10, Communications 10.1, Jeff Urich, Minister, and Andrea Kanjin, Parliamentary Assistant, Ministry of the Environment, Conservation and Parks, email dated March 11, 2020, regarding an invitation to the Region of Peel to join the province in its first official day of action on litter on May 12, 2020. Referral to a public works is what is recommended. I have consent. Item 11, items related to health. 12, communications. The first item is 12.1 under health. Christine Massey, spokesperson, Fluoride Peel, Free Peel, email dated March 6, 2020, regarding federal report finding fluoride lowers IQ of children reviewed by National Academy of Sciences, here recommended for receipt. That is on consent. Item 13, related to Human Services. 13.1, Canada-Ontario Housing Benefit Program and regulatory changes to subsidy administration. On consent, 14, communication items. 14.1, Minister Steve Clark, Minister of Municipal Affairs and Housing, letter dated April 1, 2020, advising an allocation of the funding investments for the Social Services Relief Fund, referral to Human Services and Finance Committee recommended, related to items 14.2 and 21. On consent, item 14.2, John Hablander, Senior Program Development Officer, Program Delivery Branch, Ontario Region, Services Canada, Government of Canada. Email dated April 3, 2020, advising of additional funding for the Reaching Home Program and the 2020-2021 incremental funding allocation under Canada's COVID-19 Economic Response Plan to support people experience and at-risk homelessness. Referral to Human Services and Finance recommended, also related to item 14.1 and 21. On consent, 15, items related to planning and growth management. Under 16.1, communications, 16.1 and 16.2, the delegations have been withdrawn, but we have their correspondent, 16.1. On consent, 16.2. On consent, 17, items related to enterprise programs and services. Item 17.1, approach to the development of the 2021 budget related to 8.2 and 17.2. Madam Clerk, we have a presentation on that. I don't know if anybody wants consent of the document itself. Does anybody wish to hold it?
Ian St. Clair, hold.
Very good. Item 17.2, 2020 final levy bylaw related to 17.1 and bylaw 30, 2020. On consent, 17.3, 2020 borrowing report. On consent, 17.4, procurement activity report T3 September 1 to December 31, 2019, here for information. On consent, 17.5, 2019 Region of Peel Employee United Way campaign, here for information. On consent, 17.6, report of the Diversity, Equity, and Anti-Racism Committee meeting held on March 5, 2020. On consent, report of the Government Relations Committee meeting held on March 5, 2020. Also on consent, 17.8, regional role to support alternate care sites in Peel, also related to item 18.5. On consent, the communication items, 18.1, Greg Rickford, Ministry of Energy, Northern Development and Mines, email dated March 6, 2020, regarding the natural gas expansion support program, recommended for receipt. On consent, 18.2, Rod Phillips, Minister of Finance, letter dated March 25, 2020, regarding Ontario's actions plan responding to COVID-19 March 2020 financial and fiscal update, here for receipt. On consent, 18.3, Alan Donaghy, Assistant Deputy Minister, Minister of Finance, Ministry of Finance, letter dated March 25, 2020, advising of deferral of education property tax remittance 2021, reassessment, appeal deadlines, and providing additional support to municipalities, here for receipt. On consent, Madam Clerk, item 18.4 has been struck. Item 18.5, David C. Williams, Chief Medical Officer of Health, Ministry of Health, memorandum dated April 2, 2020, regarding emergency order to support public health units with human resource capacity. Receipt is recommended, and it is also related to item 17.8. On consent, Madam Clerk, other business council inquiries we'll deal with at that time. Notices of motion we will deal with at that time. So, Madam Clerk, I think that exhausts. Oh, and Madam Clerk, yes, you did want a word with regards to the in-camera. Madam Clerk, why don't you introduce the in-camera agenda items?
Items 22.1 be we'll hold that.
Yes,
There's
because
a
we have a
present-
presentation
yeah.
from internal legal staff? Yep. External staff, but internal to us, yeah.
That's correct.
Okay, we will carry on then. So we are holding 22.1. 22.2, property acquisition, Mayfield Road widening, expansion 1005417, west of Chinguacousy Road to the west side of Hurontario Street, City of Brampton, Wards 2, 6, and Town of Caledon, Ward 2. A proposed or pending acquisition or disposition of land by the municipality of local board. Do I have consent? No one wishes to hold. Thank you. 22.3, property acquisition pursuant to Section 30 of the Expropriations Act, RSO 1990 CE 26, Mississauga Road wiring, EXP 19129, north of Bovaird Drive to Mayfield Road, City of Brampton, Ward 6, another proposed or pending acquisition or disposition of land by the municipality of local board. On consent, 22.4, update on water and wastewater services. Again, another oral presentation that I believe we will be holding because there is outside information on that. So to be held, 22.4. 22.5, Region of Peel Workforce Management in response to COVID-19. I believe we may be hoping for a staff presentation or comment on that from Mary, if it is the wish of council. 22.5. Does anybody wish it held?
Yes, please, Karen Rez.
Thank you. And 22.6, March 12, 2020 Regional Council Closed Session Report. On consent. So just to be clear, going back to my list, the clerk has advised me that what we have agreed to hold on consent are items 9.1, 17.1, 20.1, 22.1, 22.4, 22.5. That concludes my list. Madam Clerk, over to you to conduct the vote.
And a mover and a seconder?
Yes. Do I have a mover and a seconder for the consent agenda?
Chris Fonseca.
Has moved it. A seconder, please.
Stephen Dasco.
Councillor Dasco has seconded it. Madam Clerk, if you could conduct the vote.
Thank you. Mayor Brown?
Yes.
Mayor Brown in favor. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
Vote in favor?
Mayor Crombie in favor. Councillor Demurla?
Yes.
Councillor Demurla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Downey?
In favor?
Councillor Downey in favor. Councillor Fonseca?
Yes.
Councillor Fonseca in favor. Councillor Fortini? Councillor Fortini? Councillor Groves?
Yes, but just a quick question, Madam Clerk, with regards to the two items of correspondence, 16.1 and 16.2. There is no actions here taken, right?
There
We're
were-
just receiving?
That's correct.
Yeah. Okay, thank you. In favor?
Councillor Groves in favor. Councillor Innes?
Yes.
Councillor Innes in favor. Councillor Kovac?
Yes.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
In favor?
Councillor McFadden in favor. Councillor Medeiros?
In favor?
Councillor Medeiros in favor. Councillor Paleshi?
Yes.
Councillor Paleshi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
Yes.
Councillor Sinclair in favor. Councillor Starr?
Yes.
Councillor Starr in favor. Mayor Thompson?
Yes.
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor. Carries. Thank you.
Thank you, and thank you to all for getting that done in 32 minutes. Well done. That brings us to our first item then. Item 8, staff presentations. 8.1, update on COVID-19, an oral presentation by Dr. Lawrence Lowe, Acting Medical Officer of Health. Dr. Lowe.
Thank you, Mr. Chair and members of Council, and good morning. In speaking about the current COVID-19 pandemic, I realized I haven't yet shared who exactly our foe is. Many of you have heard about this invisible virus that is circulating in our community, and I'll take a moment to do so now. This is how it begins. Usually the symptoms are nondescript. It's the great new pretender. Previously, syphilis was called the great pretender because it could imitate so many other diseases and presentations. But COVID-19's stealthiness is that it mimics diseases that are all too common and familiar to many of us. A seasonal cold, the seasonal flu, and it also spreads easily from person to person. So perhaps it starts with a cough, a mild niggling cough, a fever, and over the next few days that becomes muscle aches, shortness of breath, night sweats. All sounds fairly common, and for the vast majority of people, at 7 days, that is exactly where it turns. Like the seasonal cold, they clear it, and they quickly move to recovery, returning to normal. However, for 10% of people, they need a little more attention. Some fluids for dehydration, or maybe some oxygen because they're having difficulty breathing. For the final 5%, though, they require intensive care. Many of these people will need mechanical assisted ventilation from ventilators, and regrettably some of them will succumb to the disease. And that essentially is what we are up against. And the trouble is that there is a lot of confusion in the public as well, because at an individual level, COVID-19 will pass easily for many people. But for some, particularly the most vulnerable in our society, and even for young people on the odd case, it does lead to serious consequences, sometimes fatal. And no one really knows how their immune system will react to this new virus. This actually starts to matter even more when you then look at things from a community level. Because this is a new virus, none of us have any natural immunity to it. And because it is a virus that has shown that it spreads relatively easily through droplets from person to person, it then becomes a numbers game. The more interactions we have, the more it spreads amongst the population, and then the more people will have it. And then you essentially start to broaden those percentages out across the population. 85% of a million, sure, that's the people that will have mild disease. But 5% of a million is still 50,000 people. And over weeks and months, there is not a hospital on earth that could handle that sort of intensive care surge. And this is what we mean when we're talking about planking the curve. It means slowing the flow of potential cases that might need healthcare and intensive care from a flood to a trickle, knowing that spread will still continue more slowly, and ideally that we just don't want it all to happen at once. And so, in thinking about how things begin, I will also say that this is the week where the pandemic is starting to unfold in our community. We are seeing an initial rise in cases associated with the bottom of the curve that we've talked about. And following behind, as you've heard me speak about before, we are also starting to see a slow rise in healthcare utilization and are also regrettably starting to see our first deaths in the community. As of yesterday morning, we had 684 cases and 9 deaths in the region of Peel, though this number will rise when the update comes in, actually at this exact moment at 10 o'clock in the morning. They are counted among over 4,000 cases and 174 deaths in Ontario, and nearly 20,000 cases and over 400 deaths in Canada, among 1 million cases worldwide. We now have established community transmission in Peel and in the Greater Toronto Area, and we also have a number of institutional outbreaks that have been identified that we are responding to. We have an outbreak on one ward in one of our area hospitals, and also in 5 long-term care homes, which certainly raises concern for me, and I imagine for many of you, knowing the news that we have heard around long-term care homes in other parts of the province. Our numbers continue to rise steadily, and our team continues to work to aggressively manage every case in contact that is identified to us. I will state that I am optimistic that the measures that were taken in late March will start to bear fruit in the coming weeks. I will temper that optimism, however, by reminding Council that the picture is going to grow worse before the clouds begin to clear. Cases and severity will continue to rise in the near term, but that is essentially how the curve looks. That is how the curve begins. So while we cannot change what we have done in the past and can only sort of monitor what changes day to day in the coming week, we can change the future by continuing to take the decisive steps that we have taken now. Peel Public Health continues to devote significant resources to slowing the spread of COVID-19 in our community. Nearly 75% of our staff have been redeployed to support the outbreak and the broader operations of our response. 18% of them are involved in critical functions, specifically case and contact management, as I've described, and our call center. We have staffed up our call center, and times and abandonment rates have dropped since our last update. We continue to train many more staff to assist with case and contact management, and we continue to explore technological solutions to streamline our processes and also our reach, and also provincial resources that have recently been offered to assist with more of the routine aspects of case and contact management. We have also worked with all of you and with our community partners to put in orders and recommendations that promote physical distancing. Last week, I followed with other medical officers of health in issuing a Class Section 22 order that requires people who have been diagnosed with COVID-19 to self-isolate at home for 14 days or face fines under the Health Protection and Promotion Act. That order supports an existing federal quarantine order that similarly requires residents returning from abroad to self-isolate at home or enter a federally designated quarantine facility for 14 days from their return. We ourselves have also taken our advice around physical distancing at regional buildings to reduce the risk of transmission in the workplace by instituting active screening of employees entering 7120 here Ontario Street, and also putting clear reminders of the need for physical distancing by marking out areas and putting signs and reminders throughout our floors. This is meant to protect the staff, the critical staff that remain on site, supporting our response. Finally, we have also continued to support our broader government efforts to enforce provincial emergency orders to close non-essential businesses and limit public gatherings to 5 or less. We also continue to provide significant guidance and directions on questions around facilities, particularly with our long-term care partners, to investigate outbreaks and put stronger protective and preventive measures in place. And we also, as I mentioned, in terms of our basic fundamental work as Peel Public Health, we continue to interrupt transmission by investigating every single case in contact that we receive so that those individuals can be isolated and are not transmitting the disease in the community. I also know that the provincial government has cleared the COVID-19 testing backlog and brought new capacity online. They've launched a new online portal for checking test results, and is eminently about to launch a new provincial testing strategy to allow us to get ahead of this virus. And for the reliance that we have on testing in our work, I certainly welcome that announcement. All of these efforts, however, require our community and our public to do their part as well. And in doing so, I will briefly review again the clear recommendations we have made to every single resident in Peel. As I've stated, for those who are sick or returning to Canada, they need to adhere to federal and local orders to self-isolate or risk sanction. For those that are well, we strongly recommend still that they stay home and emerge only for essential needs: groceries once a week, medicines or seeking health care, and exercising on their own with a pet or with a partner from the same household, basically maintaining physical distancing while they do. This advice is especially important for our seniors over 70 and those with pre-existing medical conditions. If you do have to go out for any essential reason, as I've mentioned, maintaining physical distancing of 2 meters or 6 feet from others while out and about, washing hands frequently, and avoiding touching one's face is the best defense against this virus. There is also new evidence to suggest that where physical distancing is not possible in close quarters, a non-medical mask may help in our efforts to slow spread in our community. It's important to clarify that it does so not by protecting the wearer, but by protecting others from the wearer's germs if they are brewing a COVID-19 infection. I also have asked clearly in no uncertain terms for residents to please comply with closure regulations. For businesses that are deemed non-essential, they need to be closed. We also need residents to adhere to directions not to use playgrounds or parks, and certainly not to host large gatherings in public, especially recognizing that the holiday seasons for many of our faiths and cultures in Peel are on the way this month. I, for one, do not want to see our first responder partners, our police partners, our bylaw officers putting their health in harm's way in order to enforce the orders that have been put in place and protect the communities. And also for essential businesses, it is also strongly recommended that they protect the employees and their public by changing their operations as much as possible to promote physical distancing through steps such as limiting service to pickup or delivery, and if unable to do so, limiting the number of occupants on site and the hours of operation to reduce crowding. I've also said in many of my public remarks of late that now, even if you are deemed an essential business, it might be a good time to close anyway. It's a good opportunity to actually let your staff keep themselves safe, because we are seeing many exposures that are starting, and that is part of what we're seeing in the community when there is transmission established. But it keeps staff and it keeps the public safe if you do decide to go ahead and close. And that obviously I recognize is a call for certain businesses, but really the most important ones that we want, the essential needs that we have identified, are those that we've mentioned, that the reason that people should really be emerging for: groceries, drugs, medicines, seeking healthcare, gasoline, and certainly exercising on one's own or with a pet or partner. So I wanted to really clarify again, we are still continuing our various efforts: proactive communications, case and contact management and tracing, the broader enforcement efforts with our partner, but we need a whole of community approach, especially in this critical moment, to continue to slow the spread. We need people to stay home, stay safe, and stay well, especially for our first responders, our essential service workers, and our healthcare providers who don't have the option to stay home during these times. And so now at the end of my remarks, I'll reiterate again that this is only the beginning, but we must not let up. We must continue to drive forward with physical distancing. The curve will rise in the coming week, but I am hopeful that all our efforts will bear some fruit soon. Together we will slow spread, save lives, and protect our vulnerable populations and our healthcare system. We will make the difference. So thank you, Mr. Chair, and I'm happy to take questions from yourself or from Council.
Thank you, Dr. Lowe, and I have a list. My list is Mayor Crombie, Councillor DeMerla, then Councillor Parrish. Mayor Crombie.
Thank you, Mr. Chairman, and to Dr. Lowe. I see that the overnights have come in Mississauga is up, I believe, to 421 cases. Yesterday was 378. I think that's an increase of 43, so that's a double-digit increase. I was so hopeful yesterday when I saw the 4.5%, thought maybe we were starting to flatten that curve. But I just wanted to say what a pleasure it is to be working alongside with you, and an honor it is. In fact, I know you're only interim, but you're doing an outstanding job. You've always been there for us to provide the best guidance. You've been there when we've called on you to do our teletown halls, or on the daily briefing calls, as you have done, and you keep us up to date with all the overnight numbers and the newest procedures, the newest protocols that have come from Ontario or Canada, and we've come to rely on your very calm, patient, confidence, science-based demeanor and advice. So thank you. We're very disappointed that now 5 long-term care homes in Mississauga are facing an outbreak. That is very dire. And we do respect that there is a call in Ontario to increase testing dramatically. I know that's something that many of us thought should have been done before today. And now there's a call that everyone in long-term care facilities, including all the staff, be tested as well. And there was the concern that I had expressed to you on our call that many of the staff are part-time, and as a result work for many of the long-term care homes or seniors homes, and thus if they become infected, they can infect as well many homes. At one person can infect many homes. So I think our goal is the same. We want to ensure that everyone is abiding by the guidelines, that all non-essential businesses remain closed, and that list is growing smaller each week. And as a result of your advice, we took some very hard measures, difficult measures, not only to close the facilities in our parks, close our parking lots. Yesterday we shut down all our events right to July 3rd. That was very tough, so that included Canada Day. We even closed Korea Park during Cherry cherry blossom season. So some very tough decisions have been made. I know that Mississauga, like Brampton, Caledon, all the municipalities across Ontario, in fact, across Canada, are very concerned about our deficit position as well, and that municipalities are not permitted to run a deficit, but that's not your issue, it's ours. We're here with you to flatten that curve, to stop the spread of the virus, and especially our concern, like yours, is for our seniors, those who are most vulnerable in our communities, pregnant people, pregnant women, those with autoimmune deficiencies, underlying conditions, and our seniors. I know you've said that anyone over 70 should remain home. They can continue to go on walks on their own, but it's best that they rely on others, including their support networks and their families, to deliver groceries and medicines, etc., and that the gatherings be limited to under 5 people, probably 2 people, unrelated people, is best. We're now approaching high religious holidays. Passover began last night, Easter weekend, this weekend, Ramadan in 2 weeks. It's a time when extended families get together, and so we're encouraging everyone to get together, whether it's by Skype or Zoom or Party House Chat, whatever those new apps are called. I've had to learn so many of them this WebEx included. We asked them to get together virtually this year. It's really tough because I know families like to gather over the high holidays, but not this year. This is not the time for groups to gather. So I'm just saying that we all stand with you, Dr. Lowe, and we want to know what more we can do to stop the spread of this virus, because it's in the best interest, the health and safety of all our residents. We want to protect our healthcare workers, our frontline workers. We thank them for all they do. We thank the paramedics, Peel Regional Police, frontline healthcare workers, our transit drivers at ATU, our grocery store workers, these gas station attendants, people at the pharmacies. These are our heroes, transport truck drivers. I could go on and on, airport workers, folks that are keeping our economy going, that are essential services. So, Dr. Lowe, is there anything more, any other measures that you think would be vital to stopping the spread of the virus? You let us know here at Peel Region, and we'll undertake those measures at each of our councils. As you know, Mississauga Council continues to meet each week on Wednesdays, though virtually. We continue to make decisions together. We consult one another. We consult all our stakeholder groups, business stakeholders, seniors, residents associations.
Madam Mayor, I think I've given you a long enough preamble. I think the question was, what else is it that we can do?
And we will do it to flatten that curve, because we don't want that surge that we think could come to come.
Thank you. Thank you.
We're building for a surge, and we don't want it to come. Thank you, Dr. Lowe. Over to you.
Thank you, Madam Mayor, and through the chair. There are lots of different measures that we are exploring, and I think we have the good fortune, at least here in Canada, of seeing steps that were taken in other jurisdictions to limit transmissions, for example, within households, within healthcare worker communities, all these other pieces. I don't have a specific recommendation for you today, but I can tell you that there are many measures that are meant to look at those groups that we are actively examining, and certainly I would hope to be able to bring that to council, either at a future meeting or even before, depending on the necessity and urgency by which we identify a need, to actually put in place some additional measures to protect those vulnerable communities. Certainly individuals who are experiencing homeless and all these other folks as well. These are all really our focus in all these pieces. And one thing that I will sort of stress here as well, there is a recognition as well that our advice is not something that can be universally taken up, and it is not something that has the same impact of everyone across the region. We recognize that there are many residents who are already living in extremely challenging situations, even during the best of times. And so I think to the extent that we are also sort of trying to apply a bit of an equity lens to both our recommendations, I think a lot of our current discussions are really trying to figure out what are some recommendations that we can put in place to protect those who are vulnerable to the disease, and what are also steps that we can take to actually protect people who may be vulnerable by virtue of some of the measures that have been taken. And so those conversations are actively continuing, and I'll be sure to bring them back.
Just a small follow-up. Folks like yourself who you work with a physician, she's an essential worker, you're an essential worker. How do people who live with essential workers protect themselves and their families?
So, through the chair, thank you, Madam Mayor, for the question. And to share with council, my wife is a family physician, and essentially both of us are essential to the response, as it were. And so certainly we think about all the essential workers that are having the same sort of dilemma, and that's also part of the conversation I mentioned in terms of really looking at healthcare workers and how we can keep them safe and limit transmission. Those discussions are certainly ongoing, and we're learning from jurisdictions elsewhere in the world. What I can tell you from my own personal situation, and also just broadly around most healthcare workers, is they are taking a lot of steps to really, first of all, ensure, and there's a need, just making sure that they have the appropriate personal protective equipment at work, and making sure that they are taking the steps to protect themselves while they are serving the community. But certainly when they return home, all of us are actively self-monitoring, even the slightest thing like a new mild cough. And you'll remember I started out my remarks by identifying that this is really kind of the great pretender, because you could just think it's another cold, but it could actually be COVID. And so anything, even just like a slight runny nose, even just sort of cough, is an indication for someone who is at high risk, like a healthcare worker, to start taking measures to self-isolate. And that can either mean either removing oneself from the home, as I know some healthcare workers have done, but for those who don't have the luxury of doing so, or who don't wish to be apart from their families, making sure that they're in a separate room, that they're masking when they're in close contact with their families. These are all sort of steps that we are prepared to take in the event that we do start in the event that our self-monitoring identifies something that may be out of the ordinary.
Thank you, Dr.
for the
Lowe.
question, Madam Mayor.
Thank you, Councillor DeMerla.
Thank you, Chair. Can you hear me?
I can hear you, Councillor DeMerla, yes.
Okay. Dr. Lowe, I'd like to echo the Mayor's comments in terms of it's just been really wonderful working with you. An issue that I wanted to just highlight is one we've been working on, which was of particular interest to me, which has been around recommendations for high-rise buildings and property managers. So, in your email to me, I thought I got the sense that the region of Peel would be coming out with some kind of recommendations for property managers. I have to say that I have reached out to a number of property managers in my ward, and almost all of them that I've spoken to so far, and I have to admit they are the larger ones, are already putting into practice a number of the suggestions that you passed on to me. But I just wanted to make sure two things. One is that even the smaller property managers are getting the message, and two, it would be really helpful if the region of Peel put its the health unit, public health, put its weight behind and sort of made them semi-official, at least, the recommendations, so that they carry more weight. So I just wanted to hear your thoughts on that. And then my second question was, Mayor Crombie hinted at it, but I had a more particular question, which is, I'm just curious as to, I understand that the testing is going to be ramped up, I guess, beginning today. So would you be able to give some sense of, in the region of Peel, what that ramp up would look like, as in how many were we doing on average until yesterday, and what that number might look like going forward? Thank you.
Thank you so much for the question, Councillor DeMerla, and through the chair, I'm happy to speak first to the question around property management and buildings. What I can share with you, actually, and I had left this out of my remarks sort of as a bit of an oversight, we are actually moving to a more proactive communication strategy as well. We recognize that a lot of people out there are really trying to think about the health impacts of COVID-19 and the implications it has for your business, for your, whether it's a property or whether it's, a community center or whatever the case might be. You'll all have probably seen the communication that I issued yesterday around farmers markets, which we do know with farmers markets is starting to come out. So I'm happy to sort of go back and review our proactive communication strategy that's currently being implemented to see maybe we can actually do more targeted communications to say, all right, so today we're going to put out messaging around property management and buildings, and tomorrow we're going to put out stuff around, emergency childcare or whatever the case might be, like basically just try to identify specific groups that we know are still needing this information and are still working in our community. So hopefully that would lend a little bit more of an official sense to some of the guidance that we've already put out on our website, and address that issue. In terms of the testing piece, I will say that I am still waiting very, very patiently, and I know that it's coming. And I can also share that Peel's own Dr. Jessica Hopkins is now at Public Health Ontario, and I believe she's actually involved in developing the provincial testing strategy at this point in time. So it's nice to see that we still have support from her and from Public Health Ontario in putting this forward. How I imagine increased testing might roll out in the region of Peel would be sort of reviewing the existing testing criteria. So as you know, the previous testing criteria have really focused on high-risk populations and those that work with them through our assessment centers. I think there's two things that we're actively discussing, which is both, first of all, a loosening of those possibly at assessment centers, and that will be through conversations with our hospital partners to determine what makes sense for the spread we're seeing in the community. But also testing at other sites where people aren't able to go to assessment centers, and that is where the question around long-term care homes is something that is also being actively explored at this point in time. So I think it'll all depend on to some extent a larger provincial testing strategy. But for Peel, I think it'll be for us looking at those sort of pieces there. And in terms of specific tests that are being done, that number is, and I've shared with members of council at different times here and there, the number of specific people that are tested in Peel is hard to come by because most of the assessment centers serve not just people in Peel but people from other neighboring communities as well. But similarly, the best and most accurate place is actually all tracked through Public Health Ontario Laboratory around the number of tests that are done. But in order to get the specific Peel numbers out of those numbers, they would have to do a data pull, like a one-time data pull, and pull all the people with Peel addresses and send it to us. So perhaps in the future they'll be able to report that more, report a breakdown more clearly by region. But at this point in time, I don't have specific numbers around what was being done in Peel. I think it's also more important, just given how interconnected our provinces and the Greater Toronto area is, that we really do sort of look at how many tests are being done at an all of province level, just so that we are kept abreast of what the situation is there.
Thank you so much, Dr. Lowe. So I'm really, really pleased to hear that you will be coming out with targeted recommendations for high-rise buildings. If I might, I will email you a couple of groups that you might want to directly either tweet to or send an email to. One of them would be the FRP, or the Federation of Rental Property Owners. So, there's a couple of association groups that, if you don't mind, I will email you. And if you email them, that would be very helpful, because they would probably be able to cover a fair number of property management companies and rental building owners. Condos might be a little bit harder, but at least we can do this. But thank you again. This is a really important issue, slightly sleeper issue, and I'm glad it's getting the attention it deserves. Thank you again. Thank you, Chair. Those are my questions for now.
Thank you. Councillor Parrish.
Yes, thank you, Chair Yanika. To Dr. Lowe, thank you very much for, again, another excellent presentation. I would like, after this is all over, to sit down and talk about how we can take better precautions for the future, one of which is the long-term homes. We need a provincial regulation that no one can work a series of part-time jobs in more than one home. They spread influenza. My mom was in a home once, and it was shut down all the time because things were passing from one home to the other. And the simple flu can kill those residents. So I'm hoping to get your support and the support of my colleagues. I think we have to do it here in Peel first. If that's not possible, then we have to lobby the province to do it. Do you agree?
Councillor Parrish, if I may, and I don't know if you're comfortable with this, Commissioner Granger, but I might pass you this question just to respond, given your experience with long-term care.
Hi, it's Kathy. Can you hear me?
Yes.
Okay, thank you, through you, Chair. Thank you, Councillor Parrish, for the question. We wholeheartedly agree on this, and we continue to look at strategies to increase the number of full-time staff we have, because as you know, we do have a lot of part-time staff, and it is a challenge in the sector, and I'm pleased that there's lots of advocacy going on right now in the province to change this and enhance our staffing model. So we too are hoping that this will be one of the outcomes that come out of this pandemic to change some of that. But certainly we have cut down on the number of our staff, strongly encourage them only to choose one home, and have been refusing staff coming into our home who are working at homes that have outbreaks. So I wholeheartedly support your suggestion.
Thank you, Kathy. Second question for you, Dr. Lowe. I actually know one person who's just come through it, always staying at home, but was quite sick. I've been hearing on the news that the serum in people who have come through it, blood serum, has antibodies in it. Are we doing anything to test people through family doctors after this is over to see if we can collect some of that serum?
So thank you, Councillor Parrish, for the question through the chair. Certainly, there's two aspects to this to the question. My understanding is that serology, which is basically testing of blood to figure out if people are immune, is something that is being looked at through that provincial testing strategy that is being reviewed and developed. So I, for one, am excited, and I would be very, very keen to see what it actually says, both in terms of expected things like rollout and implementation, but also its potential uses. And then there's also some increasing question or study that is coming out of Asia, which is really looking at whether the plasma of people that have recovered may be used as a treatment. Now, there's no clear evidence that this is supported yet, and I don't know if any healthcare facilities are doing this in Canada right now. I also don't know necessarily if it's effective or not, but there are reports of it, and as always, Peel Public Health will always take a close look at whatever evidence comes forward, and we will see if this is something that we deem worthwhile or not. But so in terms of those pieces, those are sort of the two things you may be hearing around serum and COVID-19 right now, and those are my positions on both of them.
Thank you, Dr. Lowe. And the last question, I know it would be a waste to test somebody who's come through it. Pretty sure they had it at this time, but perhaps couple weeks when past all the main outbreak, would you recommend a person who thought they had it but stayed home get tested?
So thank you very much for the question, Councillor Parrish. If someone is asymptomatic and has finished the course, I wouldn't necessarily recommend testing at this time. Really, as mentioned, when we want to broaden the provincial testing strategy, I think the focus, and again, I'm speculating as to what the strategy will have, but in broadening the criteria, our focus will really be on symptomatic people, vulnerable populations, healthcare workers, as was mentioned. We certainly know that the backlog has been cleared at the provincial level, but one of our challenges would be it would be challenging if we were to basically test a lot of different people and then go into backlog again and not have that testing facility available for when we actually do need it. So the recommendation at this time is if someone has experienced the illness, has completed 14 days of self-isolation, and is feeling better, that I would likely place them on a lower priority for testing at this time.
Thank you very much.
Thank you. Councillor Dasco.
Hi, thank you, Mr. Chair, and I just want to say thanks, Dr. Lowe. Really appreciate your updates. Always a steady hand at the till. Just a quick question. Somebody had asked me, and I just wanted to put it out there. For people that have already had the flu shot, has there been any indication in terms of how severe, if somebody does contract the coronavirus, is it any less severe if they've had the flu shot? Do you know?
So thank you very much, Councillor Dasco, for the question, and through the chair. The recommendations around ensuring that people are vaccinated for influenza in addition with COVID is not in relation to protection against COVID per se. The influenza vaccine does not offer or confer any additional protection against COVID. What it does prevent is obviously a concurrent infection with influenza. And so that is why the recommendation around the flu shot exists when it comes to COVID.
Thank you.
Thank you.
Thank you, Councillor.
That exhausts my list. Dr. Lowe, I do want to thank you as well as Regional Chair and on behalf of all of us, and also our extended leadership team and the Regional Emergency Operation Committee. And I want to let you all know, Council colleagues, that the 1 hour conversation usually goes about an hour between 5 and 6 every day with the mayors and our other practitioners from the hospitals. The mayors have been amazing at bringing up virtually all of the issues that you've brought up. In fact, we were spending yesterday deciding what our holiday schedule would be to make sure that we communicate again, because we've got to stay on top of it, which brings me to my only question, Dr. Lowe. Anecdotally only, but I'm seeing the euphoria on the stock markets, which I don't understand, which is maybe why I got out of the business 30 years ago from Bay Street. And boy, at 6:40 this morning, I had a very busy drive here to the region of Peel, notwithstanding the snow at that hour. I'm a little concerned that there may be some premature euphoria out there, and people don't think that the light at the end of the tunnel is still something we have to aspire to. They may think we're there already. What do you make of that?
So thank you, Mr. Chair, for the question. As I've said in my presentation, this is the beginning. And if I can quote one of my favorite Churchill quotes, certainly this is not the end, and it's certainly not the end of the beginning. It's not the beginning of the end, but it may be the end of the beginning, at least in terms of the golden window that I had spoken about. If anything, we need to be doubling down on the advice that I've provided, and everyone is essentially mentioned to strongly to stay home as much as possible and only emerge for the most essential of reasons as I've described. And to the extent that there's so many cars still out there on the road, I would be concerned that perhaps my advice and the advice of my colleagues across the province and country are not necessarily being followed at this time.
Yeah. Thank you for that reefficence. With that, I have to move receipt. I have movers for a receipt. Perhaps Mayor Crombie and Councillor DeMero will move receipt of the report. Madam Clerk, do you require a vote?
Is there any objection? Hearing none, receipt.
Thank you all. Thank you, Dr. Lowe. That brings me to staff presentation 8.2, fiscal update on COVID-19 oral report related to item 17.1, presentation by Stephen Van Opwegen, Commissioner of Finance and Chief Financial Officer, and Norm Lund, Director Business and Financial Planning. Stephen.
Good morning, Chair Unica and members of Regional Council. Joining me today is Norm Lund, our Director of Business and Financial Planning, and Chair Unica mentioned his name already. Just wanted to follow up. Dr. Lowe provided the health perspective of the current pandemic situation. Today, I will be providing a high-level overview of the economic impact and financial risks to Peel resulting from the COVID-19 pandemic, as well as the proposed approach for development of the 2021 budget. Next slide, please.
We can't see the slides on the Skype, Stephen.
It's showing up on my Skype.
I see it as well, Councillor Ross. It's on my screen. It's Mayor Crombie.
Now it's there. That's strange. Thank you.
Okay. Carry on, Stephen. Yep, carry on, Stephen.
Starting with slide 2 again, the evolution of the COVID pandemic is impacting.
Sorry, Stephen, I'm not seeing it now either.
Did you have it originally?
I had it for a fleeting moment, and as soon as you started speaking, I just see your face.
Yeah, I don't see any of it either.
The slide has gone.
Yes,
Clerk?
It's Chris Fonseca. I don't see it either.
Because it's still showing on my screen.
Well, it's not on ours.
No, it's not. It was there.
I have some of the technical folks here in the room having a look at that. I'm assuming the majority of you are...
It's back now.
Oh, am I assuming that the rest that haven't spoken do in fact have it, and it's only 3 or 4 of you that don't? Right?
It's back now.
No, it's because now that the video is locked out, everybody can see it. But when the video is not locked and people are speaking, it goes to that speaker.
Correct.
So, Madam Clerk, maybe a little more clarity to all?
Please ensure all of your video icons are off so that we can lock the screen on the presentation.
I hope that helps. Why don't we give it a try? Stephen, please proceed again.
Okay, Slide 2, the evolution of the pandemic is impacting economies around the world, and our chair just spoke to it. Certainly stock markets go up and down. We're not sure whether or not they've bottomed out or not, so I wouldn't necessarily recommend sinking all your money into.
Mr.
Sorry, I can't see anything. I can't see the slide.
As soon as Stephen starts speaking, the slides disappear.
It worked last meeting.
Good technology, eh?
Not working, Steve.
It's working on my computer here. Maybe it's working on some computers and it's not working on others.
Yeah.
It's working on mine as well.
But this is Councillor Damerlan. I can either see the slide or I can hear Stephen speak.
Yeah.
Shut your video camera off. It might come on that way.
Yeah.
Laptop or an iPad?
Yeah. The technical staff are trying to guide us here. Madam Clerk, again, if you can give some guidance, Madam Clerk.
If you could send in your issue to council@peelregion.ca, we'll have a tech give you a call to assist you.
Okay, I see it on my screen now. I hope that when Stephen speaks,
So
I'll be able to.
if we could keep the comments to the emails for the council@peelregion.ca, then Commissioner Van Afwegen can continue with his presentation. Thank you.
Let's try again, Stephen. Go ahead.
So back on, hopefully everybody still sees the slides. Over 2 million Canadians have applied for employment insurance since the middle of March. In fact, I thought I read yesterday that up to 4.6 million have already applied for the CREB. This morning, unemployment was announced at 7.8%. So you'll see on the slide deck, it was 7.3. So clearly the information is changing quite rapidly when it comes to the economic situation. The pandemic-driven recession ends the longest economic expansion on record. Next slide, please. In response, the federal and provincial governments are taking significant action to support residents and businesses. Public sector debt is on the rise, and the Bank of Canada has lowered interest rates to support the Canadian economy. Next slide, please. As seen on this slide, economists continue to provide their forecasts on how the economy will perform over the next few months to 2 years. These statements that you see on the slides are already out of date as they were produced last week. The economic forecasts are being revised daily as we learn more about the full extent of the pandemic. Next slide, please. Similarly, job losses continue to mount, and I mentioned that where the unemployment rate was just a moment ago. Next slide, please. In response to the unprecedented economic effects of the pandemic, the federal government is doing everything possible to support residents and businesses alike. This slide highlights just a few of the announced financial supports being provided, and more seem to be announced on a daily basis. Next slide, please. Similarly, the provincial government has announced a range of measures to support residents and businesses. This slide contains some of the financial supports announced to date. Additionally, the private sector, such as banks and internet providers, have joined in to assist residents throughout these challenging times. Next slide, please. As with all economic recessions, there will be a road to recovery. This slide outlines what we can expect in the short term, such as a slowdown in population growth as immigration stalls, increase in unemployment, a slowdown in the housing market, and an increase in bankruptcies. In the medium term, Peel is likely to experience slower than normal population growth, elevated unemployment, and an increase in Ontario Works cases. In the longer term, the overall economy should return to a healthy state. Next slide, please. You may be wondering, how will the unprecedented changes in the economy impact Peel? This slide provides context as the 2020 budget included investments totaling $3.7 billion to create a community for life. Over the next few slides, I will provide an early picture of the impacts that we are seeing. Next slide, please. Since the outbreak of COVID-19, Peel has experienced increased expenditures that can be classified into two general categories: direct and indirect. Most of the direct costs are being driven or are being seen in the critical frontline services such as paramedic services, long-term care, public health, and in serving the homeless. Direct costs being incurred include personal protective equipment, supplies, and quarantine costs for our frontline staff. and additional cost for Safe Recovery Center for homeless residents testing positive for COVID. We've also seen some increased indirect costs or those not related to our frontline response. At the last meeting, Council approved an extra $1 million to fund community agencies in need and also trying to cope with the COVID response. Peel has also increased its bandwidth to allow regional employees to work remotely. Financially, there are some areas where we are seeing or expect to see lower or avoided costs. This includes the closure of childcare centers. Gas and electricity prices are lower, as is the number of Transhelp trips. Next slide, please. Peel's revenues are also impacted by the pandemic. Highlights include Regional Council's approval of financial relief measures to support Peel's residents and businesses. In total, these measures will cost in the range of $8.3 to $8.9 million. Investment returns and development charge revenues will be impacted for the foreseeable future. Over the next 2 to 3 years, we can expect to see an increase in property tax and utility rate write-offs. Next slide, please. This slide summarizes what we understand with respect to provincial funding to support Peel's COVID response. The current environment is fluid and new funding announcements are anticipated. Incremental costs associated with Peel's emergency response are being tracked to permit future claims for emergency funding. Next slide, please. The economic impact on Peel's revenues will be less than that experienced by single-tier and local municipalities. 87% of Peel's revenues come from fairly stable sources: external grants and subsidies, water bills, and property taxes. Only 6% of the overall revenues come from user fees and charges. Next slide, please. This slide has been updated to reflect our current forecast for both tax and utility rate programs. The estimates are based on the pandemic continuing to the end of August. We are forecasting a $15.4 million deficit for tax programs and a $4.4 million deficit for utility programs. The duration and extent of the economic impact of the pandemic is still unclear. However, as shown on this slide, Peel has sufficient financial flexibility to sustain the economic impacts in the short term. Peel, like other municipalities, requires federal and provincial funding support, similar to funding provided during SARS. And that funding support is required sooner rather than later. Next slide, please. With the unprecedented economic impact of the COVID-19 pandemic, it is important to understand Municipal Act provisions for funding operating deficits. Municipalities cannot budget for deficits. An operating deficit must be funded in the current year, such as utilizing stabilization reserves, or recovered in the next budget through tax increases or cuts in services. Without adequate stabilization reserves, municipalities may be faced with a significant budget increase or a drastic service level cuts in 2021. I believe many municipalities will require additional flexibility in the absence of federal and/or provincial funding support. Next slide, please. Included in your agenda is Report 17.1, Approach to Developing the 2021 Budget. It should be noted the report was drafted prior to the pandemic emergency. A key statistic that is used to inform the development of Peel's annual budget and ensure taxpayer affordability is inflation. As an infrastructure-intensive organization, inflation needs to be viewed through two lenses: capital and operating. The inflation on capital, or the Cost Construction Index, focuses on the average increase of cost of goods for goods and services typically used in construction, such as the price of concrete and steel. Due to the longer-term nature of the capital investments, we use a 3-year average of this index. For operating items, such as the Consumer Price Index is typically used as it focuses on the average increase of goods and services for the consumer. The Region of Peel's overall gross budget is about 70% operating and 30% capital. So the effective impact of inflation is a blend of these two types of inflation. For regionally controlled, tax-supported services, the blended inflation rate is 2.6%. These figures may be very different for 2021, given the economic impact of COVID. Next slide, please. Due to the economic uncertainty surrounding the COVID pandemic, the provincial government delayed their budget to November 2020. With the economic uncertainty surrounding the pandemic, I believe now is not the time to propose a 2021 budget target. Rather, I am recommending that the region, as well as the externally financed organizations, plan their budgets, recognizing the economic impact being felt by residents, by Peel's residents and businesses. Next slide, please. Finally, as Council requested, the proposed budget timelines have been advanced to allow for the region's 2021 budget decision-making in advance of the local municipalities. As noted earlier, the 2020-2021 provincial budget is expected for mid-November. Staff will disclose risk-based provincial funding assumptions in the proposed budget. Next slide, please. Finally, we are committed to bringing monthly fiscal updates to Council for the duration of the pandemic. The next update will be more comprehensive as the financial consequences of the pandemic become clear. Thank you. This concludes our presentation.
Thank you. I see no questions at this time. That being the case, can I have someone move receipt, perhaps Mayors Brown and... Oh,
Sorry, Mr. Chair.
did somebody have a question, please?
Yes, I did.
Go ahead, please. Who, and identify yourself, please.
My email didn't go through quick enough. Thank you very much for the presentation, Stephen. I just want to say thank you for putting this together. The problem is going forward, we don't know what's going to happen. We don't know how long this is going to last. So by not having a target at this point is the prudent thing to do. And I'll be happy to move the staff presentation, Mr. Chair.
Thank you. Moved by Councillor Ras, seconded by Mayor Brown for receipt. Madam Clerk, over to you.
Any objections? Hearing none. Received. Thank you.
Okay, thank you all. That brings us to item number 9, items related to Public Works. Chair Groves.
Thank you, Mr. Chair.
I'm sorry. Madam Clerk, how would you?
Sorry, during the emergency and when we're participating electronically, the chair doesn't transfer to the section chairs. Chair Yanika will chair the entire meeting. Thank you.
Okay, thank you. And it's the one item, thank you, and my apologies for that. So items related to Public Works, we had held 9.1, External Legal Counsel for Peel Renewable Natural Gas Center Project Document Number 2016-227N. Do I have a question, or I don't recall? Councillor Vicente.
Thank you, Mr. Chair. A couple of questions to staff. As I started reading this report, my first thought was that this is something that we see on a routine basis, especially for a large project like this, a significant project. It's not unusual to see a cost overrun. But as I read the report and went through it in more detail, I started to have more questions. And specifically, because this is such a significant project, how is it that we have the legal costs essentially almost doubled? And when I look at the reasons why the costs kind of ran ahead of us, most of these items listed here are items that, or happenings that one would expect in a complex project like this. To the point of the report, this law firm was hired because they have experience handling large complex projects. So I guess my question is, how is it that the amounts were able to get so far ahead of what we had calculated? My next question would be, what does this potentially mean for the overall budget for this project? And are we going to be looking at another request next year for additional legal fees? Thank you, Mr. Chair.
I'm thinking Andrew might answer that. Go ahead, please.
Patrick O'Connor, Regional Solicitor here. As Councillor Vicente correctly points out, this is a complex and large project. The budget for the project overall is $113 million. The biggest change that occurred that would not have been predictable at the outset when estimation of legal costs was being made is perhaps not sufficiently emphasized, but it is the site change that took place between the pre-qualification process and the issuance of the RFP. And you can imagine the disruptive effect of that, because the place that you're locating this project is very central to the type of work that has to be done to work up the project documentation. There are a couple of other things that were unpredictable in the course of the project's development. There have been changes to the types of best-in-class documentation associated with this kind of project. It's something you can appreciate would not be lending itself to a standard form of documentation, and the documents in this area have actually been evolving over the 4 years since the legal estimates were first made. Those are the main considerations. Councillor Vicente is also right to point out that it isn't that unusual to see in a project of this scale some unpredictability about overall costs at the outset, and that's what we're realizing here. So I'll leave my comments off there. If there's anything that the Commissioner of Public Works would like to add, I would invite him to do so.
Yeah, I could, thank you, Patrick, and through the chair. The only thing I would add is the remainder of our vendors on this, namely the engineering consultant, which is providing a lot of the technical expertise, appear to be on track.
Councillor Vicente, you still have the floor.
Thank you, Chair. Through you, Chair, then to Mr. Farr. So given the changes that we're seeing that were required, are we still going to be able to deliver this project more or less on budget, with the exception of the doubling of the legal fees?
Through the chair, that is our intent based on the latest information we have. As you can imagine, with our current economic conditions, our marketplace could be changing, but we're taking a very good hard look at the market, at the vendors available, and would report back to council if we see a different direction being needed.
Thank you, Chair. I have no further questions.
Thank you. Councillor Parrish.
Yes, thank you. On page 3 of the report, it talks about risk considerations if we don't continue with that firm. Was that a consideration? Hello?
Sorry, through the chair, I was wanting to see if Patrick was going to answer that. Yeah, yes, Councillor Parrish, that was definitely something we looked at, whether we should go with a different firm or even take that review in-house. And given the good work that Airden Burles has done to date, we decided that sticking with them was the right answer.
Well, I'm afraid $600,000 is a lot of money. Are they not also the firm with Harrington, who's the option 3 people? When we hire these folks, do we really make sure there's no conflict of interest?
Patrick O'Connor here. We do consider and ask them to consider where their conflicts lie. Typically, however, because of the different nature of the work that's involved in something like an LPAT appeal to the sort of commercial contract design, build, operate, maintain type of specialty that this separate arm of the large firm, Airden Burles, is engaged in, the region is best advised to permit these kinds of situations to exist, where a firm may be operating for us in one instance and against us in another.
Thank you. With Stephen D'Agostino, he's ended up saving us a lot of money by using in-house lawyers for assistance rather than a second or third from his firm. Have you asked them if they'd consider that?
We have, on this particular project, involved in-house counsel to the extent that it is sensible to do so. there's a balance to be maintained between the cost effectiveness of in-house counsel and the need for direct communication between the project team and specialists. In this instance, there's a lesser involvement of in-house counsel, I would suggest, than there is in the matter that Mr. D'Agostino is involved in, and that is appropriate. You have to sort of alter these things to suit the circumstances.
Well, through you, Mr. Chair, I'd be much happier if we had tendered this out and gotten some other bids on the second part of this. I'm not going to support $600,000. I wish you had brought us a report that showed that you did request tenders from a couple of other companies. When I'm looking at the risk considerations, they don't scare me. 600,000 does, given the times we're in. So I won't support this.
Thank you. Seeing no other speakers, Madam Clerk, over to you for the vote.
So the motion moved by Councillor Vicente. Is there a seconder?
Councillor Palashi.
Seconded by Councillor Palashi, that the contract document 2016-227N awarded to Arid and Bearless LLP be increased by $600,000 for a new total commitment of $1,440,000 excluding applicable taxes. And further, that the contract with Arid and Bearless LLP be extended until the final execution of the project agreement for the Peel Renewable Natural Gas Centre project in accordance with Procurement Bylaw 30-2018 as amended. And further, that the Commissioner of Public Works and the Director of Procurement, upon the advice of the Regional Solicitor, be authorized to approve further increases to the contract for external legal services provided by Arid and Bearless LLP that may be required prior to the final execution of the project agreement for the Peel Renewable Natural Gas Centre project. Mayor Brown?
Yes.
Mayor Brown in favor. Councillor Carlson?
No.
Councillor Carlson opposed. Mayor Crombie?
Opposed?
Mayor Crombie opposed. Councillor Demurla? Councillor Demurla? Councillor Dasco?
Opposed.
Councillor Dasco opposed. Councillor Dillon? Councillor Dillon?
Sorry, I had difficulties. Opposed.
Councillor Dillon opposed. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Opposed.
Councillor Fonseca opposed. Councillor Fortini?
Opposed.
Councillor Fortini opposed. Councillor Groves?
Opposed.
Councillor Groves opposed. Councillor Innes? Councillor Innes? Councillor Kovac?
I oppose.
Councillor Kovac opposed. Councillor Mahoney?
Opposed.
Councillor Mahoney opposed. Councillor McFadden?
Opposed.
Councillor McFadden opposed. Councillor Medeiros?
Opposed.
Councillor Medeiros opposed. Councillor Palashi?
Support.
Councillor Palashi in favor. Councillor Parrish?
Opposed.
Councillor Parrish opposed. Councillor Raz?
Opposed.
Councillor Raz opposed. Councillor Sato?
Opposed.
Councillor Sato opposed. Councillor Santos?
Support.
Councillor Santos in favor. Councillor Sinclair?
In favor.
Councillor Sinclair in favor. Councillor Starr?
No.
Councillor Starr opposed. Mayor Thompson?
In favor?
Mayor Thompson in favor. Councillor Vicente?
In favor. Thank you.
Councillor Vicente in favor.
Sorry, my computer froze. It's Councillor Innes in support.
Councillor Innes in favor.
Sorry, I couldn't vote earlier on when you were calling me. I was trying to. Can I vote now? It's
Yes.
Councillor Demurla.
Yes, you can. Councillor Demurla?
Opposed?
Councillor Demurla opposed. Motion fails.
The motion fails. Thank you. That brings us to item 17.1, items related to enterprise programs and services, approach to the development of the 2021 budget related to the report Stephen Van Offwagen gave us 8.2, and 17.2, the 2020 final levy bylaw. Councillor Sinclair, you asked this be held.
Yes, thank you. In view of the delay of the provincial budget into November and the note in the table 2 that 25% of Peel's overall revenue comes through the provincial budget and maybe some other minor sources, it looks to me as if it would be rather brave for us to stick to the timeline that has been proposed in this report. And I would suggest that the timeline get pushed further away so that the budget can be drafted carefully in view of what the province is proposing in their budget. That would be my position. Thank you.
Thank you. Through back to Stephen, which I think was the theme of his presentation. Stephen?
Through the chair, thank you for the question, Councillor Sinclair. Certainly, or the observation, certainly there is a heightened risk, and our council had asked for us to move the budget timelines forward to allow for local budgets to pass. Now, that being said, this was pre-COVID-19, pre the province announcing the delay in their budget. It certainly does create an additional risk to have the budget done not knowing what the provincial funding would look like for this year, let alone 2021 as well. Certainly take direction from council on whether we continue to move forward with the budget timelines as proposed in the document.
Just a further comment, please. I noticed Mississauga approved their budget into this year, and they still seem to be surviving, so that pushing it ahead a little bit isn't going to crash our municipalities and might be a prudent case in view of COVID-19 and the chaos that's occurring. That's my point. Thank you.
Thank you. If I don't have a motion on that, Madam Clerk? Yes, Madam Clerk, I think you should ask that question openly. We're just getting clarification here. Madam Clerk.
Councillor Sinclair, are you asking for this item to be deferred to give an opportunity for Commissioner Van Offwagen to bring back a further report because of the provincial budget delays with a new timeline? Hearing nothing, the report does have a recommendation in it. Is there a mover and a seconder for the recommendation from the report?
Karen Raz can move it.
It's Alan Thompson. I move that we defer it back for Mr. Offwagen to come back with dates to have adjusted on this. It's not time sensitive that I think it can come back to our next meeting.
So that's a motion of deferral from Mayor Thompson. Is there a seconder for a deferral motion?
Ron Starr.
Seconded by Councillor Starr. So the vote that's to be taken is a deferral to the next meeting of council for the Chief Financial Officer and Commissioner Van Offwagen to bring an updated report of the timelines. Mayor Brown?
Yes.
In favor. Councillor Carlson?
Yes.
In favor. Mayor Crombie?
Favor.
In favor. Councillor Demurla?
Yes.
In favor. Councillor Dasco?
In favor.
Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Downey? Councillor Downey? Her power is out, so I think that she's unable to connect.
In favor. I'm here.
Oh, Councillor Downey in favor?
In favor.
Councillor Fonseca?
Yes.
Councillor Fonseca in favor. Councillor Fortini?
In favor, please.
Councillor Fortini in favor. Councillor Groves?
In favor.
Councillor Groves in favor. Councillor Innes?
Yes.
Councillor Innes in favor. Councillor Kovac?
In favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
Yes.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
Yes.
Councillor Paleshi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
In favor.
Councillor Raz in favor. Councillor Sado?
Yes.
Councillor Sado in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor.
Councillor Sinclair in favor. Councillor Starr?
Yes.
Councillor Starr in favor. Mayor Thompson?
Yes.
Mayor Thompson in favor. Councillor Vicente?
Yes, thank you.
Councillor Vicente in favor. It carries.
It carries, though I did, Commissioner Van Offwegen, you came up on the screen, just a final thought?
Just a clarification, and maybe it's for the clerk. As a deferral, are we just deferring and bringing the report back, or is this direction to bring forward a different budget date for council?
It is a deferral of the existing report and an additional report or update from yourself in connection with the timeline.
Thank you.
Thank you, and as said, that carries. Okay, that brings us all the way down to item 19, other business or councillor inquiries. Seeing none on my screen, I go to item 20, notice of motion. We do have one.
Can I bring up a question?
Yes, yes, Councillor Starr, go ahead.
I'm not sure if any of you got the notification from Diabetes Canada with respect to their drop-off charity boxes, but across the province, those locations for the boxes are being used by residents to drop off garbage in the last probably week or two. And I received probably about 10 or 12 photos this morning, and it is just terrible what the residents must be cleaning out. They have time at home, and they're dumping junk and all the rest of it. I'm not sure if our staff are even aware of this. I wonder if there's a comment back from Andrew or somebody that can address this, but I've seen probably 2 or 3 of the locations, and it's just going to create more and more problems for us because people think that maybe that's a dumping spot rather than a charity box.
Yes, Councillor Starr, well said, and the media's picked up on it as well, and how disgraceful that people are deliberately throwing garbage, knowing exactly what they're doing. Through to staff, Andrew, a thought on that?
Thanks, Councillor Starr, for your question, and through the chair. This is something we've been wrestling with as well. I know our staff over the last couple of days has been working closely with local municipal staff and also with Diabetes Canada. Norm's on the line. He's been doing a lot of research with them on some ideas on communication and what we can and cannot do around this. So I'm going to pass that to Norm to give you a little bit more detail.
Sure, thank you, Andrew. And just a few details on this. These bins are used to collect used clothing across Ontario, which is then sold, and it helps generate money for companies like Diabetes and other charities to fund their efforts. The used clothing market in Ontario is closed right now. It was deemed a non-essential service, so there is nowhere for companies like Diabetes to bring used clothing. So they've kind of closed down all of their collection bins, as has every other company that has these bins. We've stopped collecting used clothing at our community recycling centers as well for the same reason. These bins, historically, anytime they get full, people tend to put stuff outside of them. And then once there's a bag or two of clothing outside, somebody always tends to throw garbage out beside that. They have definitely become a bit of a dumping ground now. People getting rid of stuff, and I was reading an article or a comment from Diabetes Canada that this isn't a charity issue. This is a resident issue. People actually, consciously going out and throwing out illegal dumping. So we have been working with the local municipal staff on 2 or 3 things. We're working on messaging to try to get some firmer messaging out to residents not to do that. We're working on cleanup efforts to kind of find the best way to keep these areas as clean as possible, and we're working on any possible enforcement if there's the opportunity to enforce these things.
Norm, that's probably not the full answer. You're working on it. What are we doing? I understand that Toronto, from the media, is actually picking up those boxes, and so that the people don't, and putting them away. What research have you done on that? I mean, the media has picked up on it, and for you to say that we're just working on it, I mean, they're going to become a dumping mess, just like when we had the sanitation or the garbage strikes.
We are, and the region is responsible for one set of bins in the community, and those are the ones that we put out with Diabetes Canada. Diabetes is collecting all of their bins and taking them back and storing them somewhere so they're not out in the community. The other bins, it's really up to the local municipalities, but we can work with them to try to get people to take those out of plazas. But that's ultimately becomes a local municipal decision if they want to. They have jurisdictions over plazas and over all the other bins to remove those.
Okay, well, part of the problem is that Diabetes Canada, because it is a charity, basically have laid off probably 90% of their people. So they don't have the people to pick up. So you're saying that Diabetes Canada is picking up their bins?
We've worked with Diabetes Canada they had bins at a lot of multi-residential buildings.
No, I'm asking a question. Pick them up.
But my understanding is that Diabetes is working to remove bins because it's simpler to remove the bins than it is to continue cleaning them up. And you're right, they don't have the resources to be going out cleaning this up all the time.
Okay, maybe I would suggest through the chair that can you look into this, because I think it's going to become a pandemic on its own. I mean, I can send you photographs where there's around the bins, it's like 30, 40 feet each way of junk. It's not clothing, it's junk. Well,
sure, if council wants, we can look into it a little bit more and report back with some options on how to deal with this at the next opportunity.
I would suggest that, because I think it's going to happen throughout the, and then we're going to have a bigger mess on our hands. Perhaps there should be signage on whatever bins are left there that these are not dumping grounds, or there's not something, just the same way we're doing with closing parks and all the rest of it. I'm not so concerned about Diabetes not getting their clothing and all the rest of it. I'm concerned about what residents are doing, using these spots as dumping ground. Anyway, can we look into that? I'm not sure, Mr. Chair. Do we need direction on that?
Ron, what I've got quite a list. I'm going to keep you in abeyance, and you may come back on the list after the conversation. We'll see how it flows from there. Okay. Because my list is Dasko, Sato, McFadden, Mayor Crombie, Parrish, Paleshi. Councillor Dasko.
Thank you.
Thank you, through the chair. And this is also garbage related. I've heard from some of the residents, I guess twofold. One is because of limitations coming in on what people can put out for garbage, it's making its way now over into the parks, and now it's becoming an issue for our parks department in Mississauga. I'm not sure if Brampton and Caledon are experiencing the same thing, but I'm wondering if this is a time that we can possibly look at the limitations when it comes to how much we're picking up right now, because this is it's having some spillover, and it's pushing it from literally the region not picking up to now our parks department is having to deal with it in a lot of cases.
Thank you, Councillor Sato.
Yes, thank you, Mr. Chair.
Sorry, hang on. That was a question
but unusual in terms of the role that you want the region to do in your community parks, though. I wasn't clear on that.
It's not for the parks, Mr. Chair. This is with regards to limiting our garbage pickup, curbside pickup.
Very good. Yes, very good point. Through to staff.
Andrew, do you want me to take that one directly?
Please.
So I would just unmute myself. Yes, Norm, let's feel free to talk about what we have planned.
Sure, and we've been thinking about that exact question. We've been talking with our contractors. As councillors will recall, at the last meeting, we told you that we were stopping bulky collection, things like sofas and furniture, and that has helped out quite a bit. We're currently just in a heavy yard waste period, so I think some of you have got notices that there's been a little bit of late yard waste collection. They seem to be caught back up today. We have talked to our contractors about, can we allow an extra bag every garbage day, or maybe 2 bags every garbage day? Can they handle that? And the responses that we got back were that they could handle an extra bag every garbage day. They could probably handle an extra 2 bags every garbage day. In either case, it will slow them down a bit, and it might result in a little bit of late collection. On balance, it's our view that that's probably worth doing, but we'd like some feedback from council on that. Just the trade-off would be residents could set out up to 2 extra garbage bags without a tag every garbage day. And the trade-off would be that collection might run into the evening a little wee bit. What was very clear from the contractors is they cannot handle unlimited garbage bags. If it gets over 2, then they'll start running into real problems with staffing and their ability to complete the work. And they absolutely cannot handle an exemption period or any the bulky waste. They want us to really stick to the current position of not collecting bulky items. So that would be I guess our response is that we can do a bag or 2 of extra garbage every garbage collection day, and we would suggest starting that probably on April 20th, which I think is a week from today, because we do expect one more heavy week of yard waste next week.
Councillor Daskell, you still have the floor.
I really appreciate that, and I would be in favor of the 2 bags myself. Thank you very much.
Thank you. Councillor McFadden.
Sorry, Mr. Chair, I was next. It's Councillor Sato.
Oh, I'm sorry. Go ahead, Councillor Sato.
Thank you. I'm listening to this. I have to say I'm really disappointed that this had to be raised by council today. And we find out, Norm, that you've already been talking to the contractor and that they can accept extra bags. I thought we made it very clear in the motion that we moved 2 weeks ago that staff was to consult with council on any changes to the garbage. I thought it was very clear then that our big concern was the dumping in the parks and along the roads, etc. And I'm absolutely amazed that there was no report on today's agenda until a councillor raised it to bring this information to us that it, quite frankly, it almost had to be dragged out of you by Councillor Dasko's question. You know, the issue of the bins, the donation bins, is not necessarily one of people donating. It's people wanting to get rid of the stuff that they have in their house because they're all stuck at home and they're cleaning. And we discussed this last week. We've been having the garbage dumping for months now. It's nothing new in our parks, and we've been trying to deal with it, but it has just become so much worse. Removing the bins does not help. I've had several locations, mostly large supermarkets, where the bins have been removed by the charities. They did that weeks ago. And the material is still dumped there because people knew that there used to be a bin. So what's happening is the staff at the stores are having to go out and remove all of this material. It's a health risk. We have people who are not used to handling garbage who are now having to handle garbage because we don't pick it up. The region won't take it. The city will certainly not clean up. It's on private property. So the only areas that the region does is if it's in our around our bus stops, etc., on our roadways, and the city is responsible for the parks. And our crews are out there removing all of that right now. Part of the issue is that when we stop the bulk collection, that where people have these large items, and instead of putting them out at the curb, if they fit in their car, they're hauling them off to where a bin used to be, and that's where they're dumping them. I think we have to start accepting the 2 extra bags with no tags. We discussed that 2 weeks ago. And, you know, we could have put this into place a week ago had staff come back and consulted with council. It doesn't have to wait to a council meeting. We all have email. All of this can be done by email. So I'm going to move a motion. I know Councillor Dasko said you would support doing that, but I think we need to have a motion of council, as we did 2 weeks ago, that we direct staff to have the contractor, as soon as possible, start allowing the 2 extra bags on a weekly basis, continue with the no bulk. I don't think it's a great idea, but I know that's a little bit more awkward for them to handle. And continue with the communication items. But, you know, next time that there are conversations with the contractor on any of these issues, can you please alert council during the time? Don't wait until the issue comes up at a council meeting. We can't wait 2 weeks to deal with these. The problem is now. Thank you.
Thank you, Councillor Sato. Just through the clerk here to get clarification from you, Councillor Dasko, and all to what we're moving forward on. Madam Clerk?
If the intention is to pass a motion today to deal with this issue, then there will be a requirement of a 2/3 vote to waive the rules, as no notice was provided of a motion. So if there's, Councillor Sato, you've put a motion on the floor. Do you have a seconder?
Councillor Dasko, I would think. Yep, Councillor Dasko. Yep.
So I'm going to move then, first of all, and I guess Councillor Dasko and I will move that council deal with the motion, and then we deal with the motion.
Very good. So why don't we, Madam Clerk?
There are speakers on the board. Is it fair for the speakers on the board, which is Councillors McFadden, Mayor Crombie, Councillor Parrish, and Councillor Paleshi, to speak to the motion once it's put on the table, presuming it carries by the 2/3? Or are they other issues that you're wishing to speak to?
Yes, Councillor McFadden, were you on this issue?
Yes, I was.
Mayor Crombie? Mayor Crombie, were you on this issue?
Yes, thank you.
Councillor,
Sorry, you gotta take a second on mute.
no problem. Councillor Parrish?
Yes.
And Councillor Paleshi?
Yes.
Okay, so I think that's appropriate. If you would allow that, Councillor Sato, let's get our 2/3 so that everything's official, and then we'd like to carry on with the list. So, Madam Clerk, to you, it's been moved by Councillor Sato, seconded by Councillor Dasko, that we deal with the matter, and per our rules, we need 2/3. I turn it over to you.
Thank you. Mayor Brown?
Yes.
In favor. Councillor Carlson?
Yes.
In favor. Mayor Crombie?
In favor.
Mayor Crombie in favor. Councillor Demurla?
Aye.
Councillor Demurla in favor. Councillor Dasco?
In favor?
Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Downey?
Yes.
Councillor Downey in favor. Councillor Fonseca?
Yes.
Councillor Fonseca in favor. Councillor Fortini?
Yes.
Councillor Fortini in favor. Councillor Groves?
In favor?
Councillor Groves in favor. Councillor Innes?
Yes.
Councillor Innes in favor. Councillor Kovac?
Yes.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
Yes.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
In favor.
Councillor Paleshi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos? Councillor Santos?
Yes.
Councillor
Yes.
Santos in favor. Councillor Sinclair?
In favor.
Councillor Sinclair in favor. Councillor Starr?
Yes.
Councillor Starr in favor. Mayor Thompson?
Yes, in favor.
Mayor Thompson in favor. Councillor Vicente?
Yes, thank you.
Councillor Vicente in favor. It carries to discuss this issue today.
It carries unanimously. It's appropriately before the chair. I have a motion before me moved by Sato and Dasco, and I have speakers to that motion. Councillor McFadden.
Thank you, Mr. Chair, and thank you, members of council, for bringing this issue up this week. As you can remember, last regional council meeting, I put this motion forward, and it was turned down, or I brought back my motion for it not to be heard. But this is exactly what I asked for. I asked for extra garbage pickup during these times when there are children home from school, when we're self-isolating. And I agree with Councillor Sato that we did ask staff to bring back some information and discuss it with us if we're going to move forward. I'm pleased that we're in agreement now that we need extra garbage pickup, but I'd ask the clerk to just bring my motion forward from last week and deal with it. I think it's the same motion as Councillor Sato and Councillor Dasco are bringing forward at this time. Those are my comments. I'm extremely pleased that we're looking at this, and it'll alleviate a lot of the dumping that's going on in our parks, at our school sites, at our plazas. So this is a win-win. I agree that maybe we don't have to allow the large items at this point, but definitely the garbage. Thank you.
Thank you, Councillor McFadden, and I do recall your retelling of history as well, but at present we've been constituted such as we are. It was just reopened. The first motion I had before me was Sato and Dasco, and that has to stand on the floor. If it were to fail, I would come to you as the clerk nods to...
Mr. Chair, I am fine with that as long as we move forward. My main concern is what's happening in our city, and I certainly don't want the dumping issue at the diabetes. I don't want it at our plazas or our schools, and definitely not in our parks, and making our parks people, both Brampton and Mississauga, being responsible to pick up other people's garbage.
Understood. Sue, thank you for that. Moving on, Mayor Crombie.
Thank you, Mr. Chair. I hope you can all hear me. So on my somewhat daily constitutional, I have observed a few things. And the first one was that people are doing a lot of purging of their homes and closets and basements because they're staying home, which is a great thing. So of course they do have extra garbage. I observed that many of them are leaving them at Salvation Army and near the donation drop-offs as well, which is a very bad thing, and that's what has been in the news lately. However, the other day I did see the diabetes box in the plaza next to me, and it's been shrink wrapped, so you cannot put anything more in it. And it looked like it was tucked to the side of the building, like it was either tucked away or waiting for pickup, Councillor Starr. So it looks like Diabetes Canada is addressing those boxes, and you could not access the opening. It's all been wrapped up with shrink wrap. So that was a very good thing. The other thing I observed while we were talking trash is the wrongful disposal of masks and latex gloves left everywhere, particularly in parking lots, in the side of the road and near parks and outside grocery stores for that matter. It seems that people leave the grocery store or the pharmacy and immediately peel off their latex gloves and then drop them on the side of the road. So we can ask people, please do the right thing and put them in a proper waste bin, or take them home with you, put them in a second plastic bag, take them home with you and dispose of them properly. So I will support the motion. I think their extra bags are needed at this time because people are home and they're doing what everybody does when they're home. They're cleaning and purging and organizing. So thanks for the motion.
Thank you. I do see Andrew Farr. Councillor Parrish, I have you next, but I do see Commissioner Farr. Did you want to insert something at this moment regarding the conversation, Commissioner Farr?
No, I'm happy to have council finish their questions.
Very good.
Then I can just adjust and try and answer them all.
Thank you, Councillor Parrish.
Thank you. Well, strangely enough, while I'm sitting in my dining room and looking out at the front of my house, I watched the garbage come by and pick up. And they took our bin, and the guy got out of the truck and put a sticker on the extra bag that was sitting there, which I had, with great authority in my voice, told my husband we were picking up because of our conversation of a couple of weeks ago. So the guy got out, put a tag on it to say he wasn't taking it, and got back into the truck. A little while later, they came by and a different truck took 6 bags of yard waste. So it was kind of a mixed show out there. But I thought we had already agreed that the 1 or 2 extra bags were allowed to go without tags. So that concerns me. Secondly, diabetes isn't the only clothing boxes that we have all through Mississauga. And I was going to suggest a motion that because the 2 big contractors we've got have the manpower and they have the vehicles, that we move a motion that they just go pick them all up, put an address tag on them and store them somewhere, because it's not just diabetes, and at least they're being responsible. And as has been mentioned, they're trying to close their boxes down or shrink wrap them. But for every 1 diabetes box, there's probably 3 others. So I think we'd have to look at the cost, and also with this motion, look at topping up the contracts with the people that are going to be picking up this extra garbage. That's not fair to have them do it all and make them stick to our original contracts. So could I ask, Jamie, are we going to have to do something with those contracts?
Through to staff.
Hi, it's Andrew here. Thanks for the question, Councillor Parrish. Sorry, go ahead.
I'm sorry, I said I apologize. I just changed your name.
Well, that is my middle name, so
go ahead.
I'll take it.
Good.
So let me see if I can answer the question from Mayor Crombie and through yourself. So what we have discussed, and first of all, let me also say we also acknowledge that this all the situation around us is moving quite quickly, and communicating clearly has been a challenge. So we acknowledge that, and I think I have a few ideas of how we can move forward with that. So if I'm hearing today, we're going to move forward, or there will be a motion moving forward that we begin collecting 2 extra bags starting on likely the collection, I think Norm said on the 20th, for 2 extra bags. We can put that into the contract. Norm can correct me if I'm wrong, but we pay the contractor based on tonnage. So the more they collect, there would be payment for them. Is that correct, Norm?
Yes, that's correct. They get paid by the ton, so if there's more bags out, they earn more money.
Okay. We can work with our contractors to address any current dumping issues around the Diabetes Canada boxes that we work with. I think there are 60 some odd locations in Mississauga. I don't recall how many in Brampton, to get those cleaned up. I don't know if we can commit today how we would go about removing all of them, but we can commit to working with them and getting back to council in relatively short order on what an approach could be. We'd have to look through manpower, vehicles, and location with our contractors, but I can't commit that that will be top of the list. We're going to work on more signage and media about no littering and working with the local municipalities as it relates to parks and other private property, and work on a system that we can provide regular updates to council on our waste management program, whether we're making changes or not. Because a lot of these are happening on a day-to-day basis, and you're correct. We recommend something one day, and then we have to change it the next day. So we can work through that.
Thank you. I carry on with, oh, sorry, anything further? Go ahead.
Yes, Mr. Chair. I know that the other boxes, the non-diabetes boxes, all have to have locations. They don't just get dropped there. They all apply for licenses with the municipalities. Can we, as a municipality, send our list in and have one central group collect these things, or do we have to deal with that in Mississauga?
I think what we could commit to is being the starting of that coordination process, working with Brampton and Mississauga to see sort of the totality of how many we're looking at and decide between the three of us. And we can, I apologize, I don't know how many are in Caledon, but certainly between us and local municipalities decide on what is the right way to get these managed.
Okay, thank you very much. Thank you.
Thank you.
Sorry, I don't have a button. Can I add something?
Please go ahead, Norm. Go ahead.
Sorry, and I apologize. And I want to be clear that the Region Appeal is working with Diabetes Canada, collecting clothing at a number of multi-residential buildings and at 10 Peel and 7120. The bins that Diabetes Canada has out in plazas, those are not associated in any way with the Region Appeal. Those are just bins that Diabetes Canada has out on their own. It's just because we're dealing with them on the other work, we're in conversation with them about all the bins, so we're quite aware of what they're doing. And I agree with Andrew, we can certainly start coordinating with the city on how to kind of manage the waste around these bins.
Thank you. And just to be clear, Councillor Sato, as you said, we've been down this path before, independent of COVID. The fact of the matter is the bin is a private piece of property, and in many instances, it's on the private property, and hence the challenges, because we've been over this in years gone by before, but all to see if we can get our heads around it. My list is Paleshi, Thompson, Fortini, Downey. Councillor Paleshi.
Thank you, Mr. Chair, and thank you to members for bringing this forward. Yesterday at the City of Brampton, I guess we're kind of on the same page. We directed staff to look into an outright ban of all these bins within the municipality and asked staff to reach out to the Region Appeal to see in other levels to see how we can go about doing that. I guess, you know, there's Diabetes Canada and there's cancer care as well, but there's a number of bins out there that are actually for-profit companies. They pay rent to the commercial plazas, so I'm not sure how we're going to send the manpower out to pick up these bins, but I'd like to have that. Hopefully, the staff have that conversation with the owners and the property owners to see if possibly, like Mayor Crombie's example, put them off to the side, shrink wrap them, out of sight, out of mind. Also, Mayor Crombie brought up a great point, and the City of Brampton moved a motion yesterday to change the disposal of gloves, masks, and wipes at some of these grocery stores mainly, and other areas that to increase our disposing fee, or the fee to the litter fee to be in line with hazardous materials. And that's basically because of the potential of these gloves having hazardous, they're hazard to our health. So we set that in motion yesterday. So I think we're all kind of speaking the same language, and I guess I'd like to thank just staff for reaching out to the contractors to see what else they can be doing I've also had a number of phone calls about our recycling centers not taking mixed waste anymore, and I was wondering if staff could possibly look at the potential for more of a lineup to limit the amount of people that are in the recycling centers, putting a cap on that, and hopefully changing that back to the acceptance of all waste at these recycling centers to try and get rid of some of the dumping. Thank you, Mr. Chair.
Thank you. Mayor Thompson.
Thank you, Mr. Chairman, and to follow up with Councillor Pleshy, that's where we're going. We've been dealing with the boxes here, the town of Orangeville and up in Dufferin County. The Solicitor General asked us all to move them, but we can't because they're licensed on private property, so we cannot interfere. But the issue is we're getting a lot of dumping, and the problem is that people are moving stuff in the large items, like even sofas and Chesterfields and everything else that are all appearing by these things. If we could get the CRCs open to take this stuff, I think it'll take the pressure, because if people are willing to move it, let's message it and direct it. The extra garbage bag is fine, but to me this isn't going to solve the issue. I think all these clothes that are in bags are contaminated anyway and cannot be used for sitting out in all the weather because they're not being dealt with. So can we somehow, I guess my question to Norm is, what can we do with our CRCs that can take this stuff? And, you know, distancing isn't the problem there because people are coming to unload into the bins. Is there any way with our CRCs, to follow up what Councillor Pleshy saying, is that we can message that people are cleaning and they're going to do this stuff, they can take it there and dispose of it. Because if not, I'm going to tell you, our roadsides are going to get filled. I'm finding that with Old School Road that borders Mayfield, the same as Wanless is a real shitstorm in Brampton, and people are just throwing stuff off into the ditches, and it's going to continue, and we're not going to solve the problem. Now we're wasting municipal staff and time out cleaning up our ditches with all this debris because they have no place to go. So can the CRCs be a solution to this problem here?
Norm?
Well, I mean, the CRCs are open right now, and people are allowed to bring garbage to CRCs right now, so I guess they could bring that stuff in as garbage. We are keeping a close eye on the number of people visiting CRCs to make sure that, you know, we're able to ensure social distancing, physical distancing on the platform. We, at some of our busier sites on the peak periods, we've started metering people going into those sites to make sure that there's not too many. Now, if people have used clothing that they want to drop off, there's no advantage to dropping that at a CRC. It won't get recycled. It won't get reused. Right now, it would have to go to landfill. We currently have a fee in place at CRCs for garbage, so people have to be aware that if they come to a CRC, they'll have to pay for their garbage disposal. But for now, that's an option that's available to them.
My question then back to you is, can we waive the fee for till the COVID is over? The clothing's going to go for garbage anyway because it's sitting out in all the elements of weather with garbage bags. They won't accept that. That's why these garbage bins or clothing bins get emptied daily, is to keep it fresh and current. With this stuff all piling up, it's garbage anyway. So my attitude is it's a loss. People either can keep it if they want it recycled for a better purpose, but if they want to get rid of it, can we just somehow allow people to take it to these CRCs so that we're just not getting it dumped on our roadside ditches? Because at the end of the day, the same taxpayer is going to pick it up one way or another, and the efficiency is more apt to have it dumped at the CRCs till after this is lifted. Can we amend the motion that we can waive the fees at CRC so that people can take this stuff and it'll go in the notify it's going into the waste stream. That's where it's going. But it's going in the waste stream anyway that's being piled up in these parking lots and shopping malls or wherever on private property.
Maybe just in response to that, we've actually thought about the possibility of waiving fees at CRCs to give people an outlet for extra garbage they might have. Our one concern is anytime we waive fees, it increases traffic to CRCs. So I realize that, and we're going to have to use distancing, but one way is our staff are going to be busy doing it one way or the other. Maybe, Mr. Chairman, I could either amend the motion or just bring in a separate motion after the fact. You tell me, please.
Yeah, Alan, I'll hold off until we've dealt with this one, then I'll come back to you just for the sake of clarity.
Mr. Chair, as the mover, I would be willing to look at that as a friendly amendment to the motion so that the other speakers can speak to that as well.
Okay, Councillor Dasko?
Thank you.
Yes, I'd be willing to accept that as well.
Very good. Properly before us then, it's a friendly amendment as such. Carrying on with our new amended motion, Councillor Fortini.
Thank you, Mr. Chair, and thank you, everyone. This is a great discussion. So, as I have a business doing maintenance and snow plowing, and a lot of these plazas I do, we've always removed them in the past. And they pop up the next day without permission and never asked and never paid rent. So we just removed one last week up at Van Kirk, one of the properties. I do maintenance there. And last night it was back there again. So how are we going to... It's not the owners or the properties that want them there, because they're not only putting clothes, they're also putting all kinds of garbage, fridge, stoves, house garbage, and that's why we always remove them. The problem is that as they're popping up at night, these companies come here in the middle of the night, and I waited many times in the night trying to catch a truck driver, and there's a number you call on there, but nobody answers the number. So they're always going to pop out at night. How are we going to deal with this when they pop up overnight without permission?
It's a very good question. I don't know who can answer, but it's to the core of what we're talking about.
And the property, the owners do not want these boxes there because it's causing a lot of problems, all kinds of garbage. And we have bins there. We have to pay for that, getting them removed and cleaning up the properties. We go every night and clean all these plazas up, and the next day there's pizza boxes and stuff like we understand, but there's gloves and everything all over the place after it's been cleaned. So it's also the residents are not using the bins the right way, but also these boxes is causing a big problem to every plaza. They're popping up overnight.
And again, Pat, having been through it before, it is a private bin on someone's private property and difficult for the local or the regional government to step in, but such is the nature of the beast. Councillor Downey.
Thank you. Through you, Chair. Good morning. Just when the motion came forward a couple of weeks ago, I think, my main concern was the added cost and the added infrastructure at that time to be able to deal with the extra garbage. So I guess my question through you, Chair, to Andrew is, where are the efficiencies in comparison? Adding an extra garbage bag to every household in Peel, or two for that matter, what's the cost to that compared to simply cleaning up the kind of bad characters that are dumping in these sites at this point?
Through the chair, thanks, Councillor Downey. I don't have in front of me how much each exemption period that we do now costs us. Do you have that, Norm?
Sorry, how much each which costs us?
At each exemption period that we do a year, because we already do a number of these every year. What we pay every week, we do that.
I don't have the number handy, but it's in the hundreds of thousands of dollars.
And so how would that compare to just having something within the contract or our own staff cleaning up these dump sites where the boxes are?
Well, and I mean, to be clear, the region doesn't have jurisdiction to clean up around these boxes, right? They're on private property. It's a local area municipality jurisdiction. We're certainly working with the staff at the area municipalities on this. I mean, if council directs us to support the local municipalities by going to clean them up, we would do it. I'd have to I'd have to talk to contractors about pricing to understand what that is. They have rental rates in our contracts where they can supply extra trucks to do different work at an hourly rate. My sense is that's how we would pay them, and that's usually, I think it's about 3 times the normal cost of garbage collection to do work on an hourly rate basis. But if that's what we do, that's how we would pay them to do it.
Right. I guess what I'd like to see then is a better comparison. I think that adding the extra bags for every household in Peel is kind of opening the floodgates when you have just a small number of bad actors in this case that are dumping, around on this private property, around these donation boxes. When we have mechanisms to decrease the fees at our CRCs and encourage people to bring their garbage there instead of these dumping sites. I think that we need to really look at the cost comparison of just cleaning up this mess as it's temporary, as opposed to having weeks and weeks and weeks potentially of unlimited garbage pickup at an exponential cost. Thank you.
Thank you, Councillor Innes.
Thank you. And I guess I was just wondering the same questions as Councillor Downey with regards to the extra cost of the extra bags. I think that even the waiving of the CRC fees, when it comes to the drop-off of clothes, as an example, from reverting from these bins, I think that we need to be very clear, if this passes, in our communications to our residents, that they are not being recycled and they are not being reused. I cleaned out my closet. I have 5 bags. They're sitting in my garage waiting until I can bring them somewhere where they will be reused, because I know if I bring them to the CRC, they will not be. So I think that if it passes, that we definitely need to make sure that the communication is clear. And I am concerned about what happens in a week's time when we're having an issue maintaining even the current service level without increasing the bag. What do we do then? Do we have to wait for a council meeting for staff to pull back on the extra bag? Because by then the damage may already be done. So I'd like to have a better and clearer understanding from Norm and his team as to the stress that this may actually put on the waste pickup. Because when I've explained it to my residents about the extra pickup, their main focus is to ensure that their current status level of waste pickup is actually happening. They get it that we need to protect our resources, because we don't know how long this is going to last. So before I would vote on this, I would like some clarification and some level of comfort from Norm and his team that this isn't going to add an extra burden on the resources that we already have.
Sure, I can answer a
Please.
little bit of that right now, and I do have a little bit more on cost.
Go ahead, please. Yes.
Okay, so when we have an exemption period, it usually costs about $500,000 for a week of exemption. If we allow people to set out 2 extra bags a week, and if every household did that, and I think if we did, our messaging would still be hold on to what you can, only set out what you have to, right, to not overburden the system. But if every household set out 2 bags, that would probably cost us about another $500,000 in collection. So a week of or a cycle of 2 bags is about the same cost as an exemption period, and this will, and I'm not trying to be difficult on all of this, but this all started a couple of weeks ago, and we're figuring things out as we go. We're measuring, we're tracking stuff. 2 weeks ago, there were a lot of unknowns. We now have 2 more weeks of operations under our belt. We have a better sense of what the staff response is on the contractors and stuff like that. So we have better information now. As I said earlier, this will put a burden on the collection contractors if they're collecting this material, right? It'll mean collection runs into the evening a little bit. They'll be a little bit later. If we get one, sickness in one of our collection yards with a COVID case, we don't know what that's going to do to the drivers, whether they'll all get scared and not come in, so those sorts of things, if they happen, we're going to have to change operations very, very quickly. If this overwhelms them, the first thing we'd probably do is cut back on yard waste collection, because that's probably less important than garbage collection. It's just our assessment right now, and these are conversations we had with the contractors yesterday. It wasn't that long ago, so today's probably the first chance we get to talk to council about them. Based on those conversations, we're pretty comfortable that they can manage 1 or 2 extra bags each garbage day, with just some minimal kind of late collection impact, unless something major changes in the future. We do get that residents are generating a bit more waste, and some of them need to set out extra, or they have extra waste, and so that's why we're suggesting the two bag exemption for now. I'd suggest we do that on a month-by-month basis. We say that we'll allow it for the next month, and then every 2 weeks we can, reevaluate and extend it if things are going well.
Thank you, Norm. Councillor Sado.
Yes, thank you, Mr. Chair. I just want to point out that by adding 2 bags, because we didn't support the full exemption period, which is what was the original motion of 2 weeks ago, and that was the concern. Norm raised that concern with the cost and with the contractor, knowing how much we get over that 1 week period, because an exemption means that everyone is putting out their garbage. They only have 1 week to put out their extra garbage. So everyone rushes to do their cleaning and throw everything out the same week. So of course the costs are going to be high, and the impact to the contractor is going to be higher. By doing it this way, by allowing people, not necessarily encouraging them, but allowing them to add a bag or 2 bags on their weekly garbage, which is only every 2 weeks for each resident, that is spreading out the amount of garbage and the collection. So it's not all focused within 1 week, and the impact is not going to be anywhere close to what we get during an exemption week. Those big pushes for collection of garbage is my understanding is what the concern originally was from the contractor. So will it cost more money? It might. But if it will prevent the dumping in the parks, and which is a health concern as we're fighting COVID-19, and we always have to put the health of the community at the forefront. I agree we need to communicate that if you can hold on to it, keep it and donate items. I think that needs to be the messaging. But if people do not have space, and in Mississauga and in Brampton as well, I guess, our residents, we have a lot of very small lots. They don't even have room for the bins the carts that we gave them. We hear that all the time. So asking them to keep bags and bags of waste that they are unable to get rid of over this period of time is just not reasonable. I like and I agreed to add Mayor Thompson's to the motion. If other members of council want to split that out, I'm fine with that either way. But it's very easy to distance at the yard, at the CRC, if you are not collecting a fee. I think from my recollection, I haven't been there in a while, but my recollection is really the only contact is when you are collecting that fee with the staff at the yard. Otherwise, you drive up to the bins and throw everything in, and then you leave. So I think it would be fairly simple to do that. and would ease up a little bit on the contractor. And if we do both at the same time, I think that's going to spread it out. Thank you.
Thank you, Andrew. Commissioner Farr, last word to you.
Trying to keep track of where this motion's going. I think it's landing in a place that most of all, we want to get clarity out of this to make sure we deliver the service that we've all agreed to today. The two big things that I believe we're going to see, and I haven't seen the motion yet, are that we would move to allow 2 bags per collection period per household. We would waive the CRC fees for garbage. And I would want to add a third thing that staff would communicate, that we would do this on a month-by-month basis, and that staff would work with, I don't know how the wording would work with council to extend it as the service is still being delivered successfully or something like that.
Mr. Chair, as the mover, my fear of putting in the motion that we allow it for a 1-month period is that we would, if that's communicated, then we are doing an exemption period of 1 month, which is basically 2 collection dates.
Understood.
And I think if we do that, then we are going to end up with everyone trying to put it out over that period of time. So I would prefer to leave that off the motion with the understanding that staff report back at the end of a 1-month period or 2 collection rotations as to how it is going. But I just don't want to see everyone focusing, saying, oh, we only have a month to do it, so let's do our big cleanup, and looking at it as an exemption period. That's what I'd like to get rid of. I think the motion, Madam Clerk, also has to say to allow the 2 bags without the requirement of tags.
Yes, you're correct.
I know that was an assumption, Andrew, but I think we maybe have to put that in the motion. But,
no, I think we'll have to make sure it's very clear.
Yeah, okay, thank you.
And I think that if I could ask just one, or add one comment at the end, Mr. Chair, through you, I think that's wise advice, Councillor Sato, and we'll just have to work through as staff of how we could make decisions sometimes in the interim if we have to stop something when there is not a council meeting. We'll have to work out how we communicate with you, but that doesn't belong in the motion.
No, actually, Andrew, that was in the motion that we passed 2 weeks ago. Okay. And I think at that time we were very clear that if things are happening during between council meetings, that consulting, with council, advising council, if an emergency situation has to be stopped, then it has to be stopped.
Okay. If we have that, if this doesn't supersede that, then I can live with that.
No, I think this is, I think it fits within what we approved at the last meeting.
Okay.
Thank you. Councillor McFadden.
Thank you, Mr. Chair. I would just like to clarify the motion that I put forward a couple of weeks ago in point 5 of my motion. I did not ask for unlimited garbage pickup, which would have been the large, heavy items. I asked that we waive the 1 cart limit for garbage waste left at the curb until further notice. So I just wanted to clarify that I didn't ask for unlimited. Thank you.
Thank you. With that, Madam Clerk, your understanding of the conversation and the words that you've crafted a motion with staff here for on behalf of Councillor Sato and Councillor Dasco. Over to you.
Thank you. This is how I've captured the motion. Having said that, if the motion needs to be split, it may be that we put the separate items into separate motions, as some councillors may feel more compelled to be able to agree to one and not some of the other accommodations. But I'll read the list now. That staff be directed to work with the region's waste collection contractor for the term of the emergency declaration or earlier as recommended by staff to permit up to 2 additional bags of waste to be collected as part of the bi-weekly residential waste collection without the requirement of purchasing bag tags commencing April 20th, 2020. And further, that bulky items not be picked up during the emergency declaration. And further, that staff work with charities with charitable collection boxes and local municipal staff to address the issue of dumping garbage at charitable donation boxes, which may include the removal of clothing donation bins. And further, that fees for dropping off waste at community recycling centers be waived throughout the emergency declaration. And further, that staff report back to council after 2 collection periods with an update on the impact to the collection process.
Councillor Sato?
Yes, I'm fine with that, Mr. Chair.
Councillor Dasco?
Yes, I'm fine with that as well.
Madam Clerk, over to you. That's the motion before the chair.
Are there any requests to separate any items from that motion to be voted on separately? Hearing none, that's the motion on the floor. Recorded vote. Mayor Brown.
Yes.
Mayor Brown in favor. Councillor Carlson.
Yes.
Councillor Carlson in favor. Mayor Crombie.
In support.
Mayor Crombie in favor. Councillor Demurla.
Yes.
Councillor Demurla in favor. Councillor Dasco.
Yes.
Councillor Dasco in favor. Councillor Dillon. Councillor Dillon. Councillor Downey.
Sorry, I'm here.
In favor.
Councillor Downey in favor. Councillor Dillon.
Yes, in favor.
Councillor Dillon in favor. Councillor Fonseca.
Yes.
Councillor Fonseca in favor. Councillor Fortini.
Yes, please.
Councillor Fortini in favor. Councillor Groves.
Yes, in favor.
Councillor Groves in favor. Councillor Innes.
Yes.
Councillor Innes in favor. Councillor Kovac.
Yes.
Councillor Kovac in favor. Councillor Mahoney.
Yes.
Councillor Mahoney in favor. Councillor McFadden.
Yes.
Councillor McFadden in favor. Councillor Medeiros.
Yes.
Councillor Medeiros in favor. Councillor Paleshi.
Yes, please.
Councillor Paleshi in favor. Councillor Parrish.
Yes.
Councillor Parrish in favor. Councillor Raz.
Yes.
Councillor Raz in favor. Councillor Sato.
Yes.
Councillor Sato in favor. Councillor Santos.
Yes.
Councillor Santos in favor. Councillor Sinclair.
In favor?
Councillor Sinclair in favor. Councillor Starr.
Yes.
Councillor Starr in favor. Mayor Thompson.
Yes.
Mayor Thompson in favor. Councillor Vicente.
Yes, thank you.
Councillor Vicente in favor. It carries.
Thank you. With that, are there any other councillor inquiries or business that anyone else would like to raise on other topics? Seeing or hearing none, I go to notices of motion. We have one before us. The funding allocations to the COVID-19 Emergency Response Fund as requested by Councillor Medeiros related to items 14.1 and 14.2 to be dealt with at our next session. Bylaws. Madam Clerk, over to you. Oh, I'm sorry. If we had proper notice in time, we can deal with it today. Councillor Medeiros, with regards to your notice of motion 20.1, would you like to speak to your motion?
No, I think it's pretty self-explanatory. It's just giving authority to our human services staff, the commissioner and director, as it's stated in the motion. I'm not sure if our Commissioner Janice, if you'd like to add something for councillor's information.
And Mr. Chair, it's Parrish here. I'm seconding it.
Thank you, Carolyn. So it's duly moved and seconded. Did the commissioner wish to add anything?
Thank you, Councillor Medeiros, and through the chair. No, just we are looking for the flexibility to continue processing applications, given that we anticipate receiving the Reaching Home funding and the Social Services Relief Fund in the next few weeks. So we will have that funding available to assist us.
Thank you, Madam Clerk. Over to you.
I'll read the motion that's on the floor, moved by Councillor Medeiros, seconded by Councillor Parrish. Whereas the March 26, 2020 Regional Council meeting, the report titled Supporting the Region of Peel's Community Agencies During the COVID-19 Pandemic was approved to increase Community Investment Program grant funding by $1 million from existing working fund reserves to support emergency grant payments on a one-time basis to community agencies. And whereas the need from the community agencies is anticipated to extend beyond the $1 million. And whereas the Ministry of Municipal Affairs and Housing has advised that the Region of Peel will receive $5,988,400 for the 2020-21 Social Support Relief Fund. And whereas Service Canada has advised that the Region of Peel will receive an additional $918,019 for the Reaching Home program, as well as $4,928,602 for an incremental funding allocation under Canada's COVID-19 Economic Response Plan for homelessness for 2020-21. And whereas a report will be brought forward to the April 23, 2020 Regional Council meeting to outline and request the authority required to enter into funding agreements with the provincial and federal governments. And whereas there is a need to bridge the timing gap for funding prior to the aforementioned agreements being entered into. Therefore, be it resolved that the Commissioner of Human Services, Commissioner of Health Services, Director of Community Partnerships, and/or Director of Senior Services Development be granted authority to continue to receive and process applications to the COVID-19 Emergency Response Fund through the Community Investment Program beyond the original $1 million allocation, not solely on a one-time basis to any specific agency, and to exclude grant agreements to disperse the funding on business terms satisfactory to the Commissioner of Human Services and/or the Commissioner of Health Services, and on legal terms satisfactory to the regional solicitor. Mayor Brown?
I see Commissioner Van Offwagen's come on my screen. Commissioner, did you have a thought on this?
It's related to another matter, so I can wait for the appropriate time.
Thank you.
Thank you. We're calling the vote then. Mayor Brown?
Yes.
Mayor Brown in favor. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
Yes.
Mayor Crombie in favor. Councillor Demurla?
Yes.
Councillor Demurla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes.
Councillor Fonseca in favor. Councillor Fortini?
Yes.
Councillor Fortini in favor. Councillor Groves?
Yes.
Councillor Groves in favor. Councillor Innes?
Yes.
Councillor Innes in favor. Councillor Kovac?
Yes.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
Yes.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
In favor?
Councillor Paleshi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor?
Councillor Sinclair in favor. Councillor Starr?
Yes.
Councillor Starr in favor. Mayor Thompson?
Yes.
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor. Carries.
Thank you. Stephen, back over to you. Did you have other business before the chair, Stephen?
Thank you, Chair. Just for clarity, I understand from clerks that the motion on the deferral of the approach to the 2021 budget was to the next council meeting. To do so requires us to coordinate with the local municipalities on a revised schedule as well as the external agencies. So if council's okay, and my sense was council didn't see this as an urgent matter, that if we could defer it to the May 14th meeting, it would give us time to have those conversations with our partners in developing the budget schedule.
Thank you. Understood. Around the table, so to speak, is that acceptable to all, given that it leaves, or are there any objections to that? That instead of 2 weeks hence, it's 4 weeks hence, so we can talk to our local partners. Hearing no objections to that, it will come back 4 weeks hence. Stephen, thank you. Okay, the bylaws. Madam Clerk, over to you.
Thank you. A motion moved by Councillor Paleshi, seconded by Councillor Fonseca, that the bylaw listed on the April 9th, 2020 Regional Council agenda, being bylaw 30-2020, be given the required number of readings, taken as read, signed by the regional chair and the regional clerk, and the corporate seal be affixed hereto. Any objections?
Hearing no objections, that carries. Okay, that brings us to item 22. I'm sorry? Oh, Councillor Sato, did you note an objection to that, just for the record, Councillor Sato?
No, Mr. Chairman, I wanted to speak to get some clarity on the motion that we passed on the waste. I just had an inquiry from a resident.
Okay, so
and I'd like to raise it.
we've dealt with the bylaw. You had no concern with that. Go ahead, Councillor Sato.
Okay, so a resident, when I mentioned that we were going to allow the 2 additional bags, the question, without tags, the question came up saying, well, we're allowed 2 now with tags, because we didn't remove that. So does that mean we're allowed 4? And so I think we need to have it clarified, not necessarily in the motion, because we passed that, but I think we need to have it clarified very much to residents that they're not actually getting more additional than they already have with tags. They're just not having to pay for tags. So maybe Andrew can just confirm all of that.
Through the chair, you are correct, Councillor Sato. The intent of the motion was to allow everyone to set out 2 bags without using bag tags, not to set out 2 bags with tags and 2 bags without tags.
Okay. Yeah, I think maybe, and Madam Clerk, maybe you can advise how we can deal with this, because I think the motion may not have been that clear, and I hadn't thought about that at the time, because the intent was 2 bags, but we're currently allowing 2 bags, so the only change is without the tags.
That is correct. That is the way that the motion is worded, that it was the relief from having to obtain tags.
Right.
So it would encourage people to set out their 2 bags as opposed to dumping them elsewhere. That's
Right.
my
Okay.
understanding.
Okay, I just wanted to make that very, very clear, because that we didn't inadvertently enable people to put out 4 using tags. So basically the message that's going out then is that tags are no longer required.
Yeah, hold on to your tags until this is over. Correct.
Okay, thank you.
Yeah, we'll work on. I'm glad that you clarified that to make sure we get the communications right, because we might have missed that subtlety.
Yeah, I did it too until someone posted and said, "Oh, now we're allowed 4." So
people are fast.
Okay.
Yes.
Thank you. Moving on, I'm on to item 22, in-camera matters. Madam Clerk, I'm going to come back to you to make sure. Normally, we just kick everybody out and close the doors, but it's not that simple. So, Madam Clerk, please satisfy yourself that we're properly constituted in camera.
Thank you. So we are going to be moving into closed session. You do not have a video option during in-camera. The screen is locked with the closed session logo. As per the rules of electronic participation, each of you must declare that you will adhere to the confidentiality standards as outlined in the Regional Council Code of Conduct, which provides, when making decisions, the regional chair and members of council will have access to information that may be confidential or contentious. The regional chair and members of council will respect and maintain the confidentiality of information communicated to them in confidence by staff or colleagues. The regional chair and members of council will not disclose a document or information contained within a document provided for use in connection with a closed in-camera meeting of regional council. The regional chair and members of council will not disclose the deliberations of a closed session without the proper permission of the body holding the closed session. If you cannot make the stated declaration or appropriate arrangements so that any other persons cannot see or hear any of the confidential deliberations taking place, please indicate that you are withdrawing from the meeting until we have moved back into open session. We're going to pause here for about 3 minutes in order for each of you to make necessary arrangements to provide for an in-camera session, and for people to log off the Skype if you're not to be in the closed session. So we'll pause for 2 or 3 minutes while that occurs. Thank you for your patience. The motion moved by Councillor Dillon, seconded by Councillor Santos, that the in-camera communication item listed as item 22.1 on the April 9th, 2020 Regional Council agenda be received, and further that the oral in-camera update listed on item 22.4 be received, and further that the in-camera report listed as item 22.5 be received. That's a recorded vote. Mayor Brown,
Yes.
Mayor Brown in favor, Councillor Carlson,
Yes.
Councillor Carlson in favor, Mayor Crombie,
Yes?
Mayor Crombie in favor, Councillor Demurla, Councillor Demurla, Councillor Dasco,
Yes.
Councillor Dasco in favor, Councillor Dillon, Councillor Dillon,
Sorry, yes.
Councillor
Madam
Dillon in
Clerk, it's Mayor
favor.
Crombie. Sorry, Madam Clerk, it's Mayor Crombie. Councillor Demurla always has troubles unmuting, and Councillor Fonseca can't get back on the line. If you could send IT to assist Councillor Chris Fonseca, please.
Thank you,
Yes,
Bonnie.
thank you. Councillor Downey,
In favor.
Councillor Downey in favor, Councillor Fonseca, we'll circle back. Councillor Fortini,
Yes, in favor.
Councillor Fortini in favor, Councillor Groves,
Yes.
Councillor Groves in favor, Councillor Innes,
Yes.
Councillor Innes in favor, Councillor Kovac,
In favor.
Councillor Kovac in favor, Councillor Mahoney,
Yes.
Councillor Mahoney in favor, Councillor McFadden,
Yes.
Councillor McFadden in favor, Councillor Medeiros,
Yes.
Councillor Medeiros in favor, Councillor Paleshi,
Yes.
Councillor Paleshi in favor, Councillor Parrish,
Yes.
Councillor Parrish in favor, Councillor Raz,
Yes.
Councillor Raz in favor, Councillor Sato,
Yes.
Councillor Sato in favor, Councillor Santos,
Yes.
Councillor Santos in favor, Councillor Sinclair,
In favor?
Councillor Sinclair in favor, Councillor Starr,
Yes.
Councillor Starr in favor, Mayor Thompson. Don't believe he's on the meeting. Councillor Vicente,
Yes.
Councillor Vicente in favor. We'll just link back to Councillor Demurla, Councillor Fonseca, motion does carry.
And Bonnie and others, my staff keep furtively letting me know we're trying to reconnect and do whatever it is that we can do to link back up. Madam Clerk, back to you. Moving on. What else was before the chair? Councillor Groves, I have you on the list regarding matters coming out of in camera. Councillor Groves?
Yes, Mr. Chair?
Yes, I see you on my list.
Yes, and I'm not sure if this is the appropriate time to do this, but I would like to move a motion with regards to the PZ lands in relation to option 6 that they be removed.
Let me just stop you right there because the clerk requires some clarity on that, Madam Clerk.
Councillor Groves, there was no notice of this motion, so are you proposing the motion as a notice for the next meeting? And if that's the case, we could take some time to actually get the motion worded the way that is best for your purposes to be heard at the next council meeting, rather than trying to craft it at this moment, when you wouldn't be able to hear it at this meeting without 2/3 to actually hear it at this meeting, because there has been no notice of this motion been provided to the public.
Madam Clerk, I'm fine with working with you to craft that motion and for the next meeting.
Thank you very much. We'll be in touch after the meeting then. Thank you.
Thank you. Madam Clerk, carrying on, what else is before the chair?
Next is the bylaw to confirm.
I will take it from you. I have a bylaw here moved by Councillor Mahoney, seconded by Councillor Carlson, that bylaw 31-2020 to confirm the proceedings of Regional Council at its meeting held April 9, 2020, and to authorize the execution of documents in accordance with the Region Appeal bylaws relating thereto, be given the required number of readings, taken as read, signed by the Regional Chair and the Regional Clerk, and the corporate seal be affixed thereto. Madam Clerk, call the vote.
Are there any objections? I see Councillor Parrish has just gone on the...
Councillor Parrish?
I need a clarification. In Mississauga, a motion that arises out of the business of council can be voted on at that meeting. I know we don't have that apparently at the region. I would like assistance from Catherine to draft a motion to change that.
Councillor Parrish, we actually do have that as well. The motion, though, that we were talking about, the matter that was on the agenda was in relation to the legal advice from from Mr. D'Agostino, not in relationship to the actual classification of the lands.
I might want to challenge the chair on that interpretation. I think the whole thing came out of the in-camera, and I think the motion is legitimate, and I think we could take a pause while we draft it.
Madam Clerk, I agree with the interpretation of the clerk. I think it's separate from the in-camera report that we were given on the state of affairs regarding that item 22.1.
I challenge the chair.
Okay.
Madam Clerk, it's Mayor Crombie. Just point of order. We have 2 members that are still desperately trying to get on and would like to be able to participate and vote. So I'd like to take this opportunity while you craft this motion and challenge the chair to get these 2 councillors back on the call, please, back on the line.
And Bonnie, fair point. Bonnie, I'm looking over to our technical people, and as I say, they're working on the same thing you have asked and have been trying to since the in-camera, but with no luck. And I think it's befallen Mayor Thompson perhaps as well. But we'll take a moment more, Madam Clerk.
Might have germs.
Do you want me to put this on?
No.
Okay.
Another point of information, please, Mr. Chair, is that, this is now technology that has failed us twice. Could we not find something that's a little more consistent? We've been using WebEx at the city, others use Zoom, and we haven't had this issue where people are falling off calls and not able to get back on. So could we explore for the next meeting something a little more reliable, please?
Absolutely, Madam. Urgently to do so. The chair takes that as a very stern direction because it is unacceptable. I agree. So, Madam Clerk, if you can couch the question before my council colleagues regarding the challenge of the chair, what is the matter before you?
Thank you. So as the ruling has been challenged by the chair, then we're going to call a vote without debate on the following question. Shall the decision of the presiding officer be sustained? Voting yes means that the ruling of the chair is agreed to, and the motion will be at the next council meeting. Voting no means that the motion could be brought forward to this meeting with a 2/3 vote to.
Madam Clerk,
Yes.
I've got 2 members that would like to vote on this. They want to know what the call-in number, please, is. I'll give it to them because you can't proceed with this vote. I've been asking you to pause so I can get 2 members back on the call.
Yeah. Yes, and
So what's the phone number what is the number? They're both looking.
We have reached out to them via email.
They have the phone. They're asking me the number, and they just asked me as you were reading. So what is the number? The call-in.
I'm just getting that number. It has been sent to them. Just 1 second.
If all members can't vote on it, we could always just do it at the next meeting. This is not urgent COVID-19 business.
Chair Brown, it is before the chair, and I've called the vote, and I believe we have to proceed. Madam Clerk, are you able to to provide that number?
Yes, the phone number is 1-647-749-9098, and the code is conference code 234-265-203.
And I'll have you repeat that if you could.
Sure. 1-647 749-9098, and the conference code is 234-265-203, and this information has been emailed to both of them as well.
I'll allow...
Okay, you wait, no, hang on. You said 234, but the first time I wrote down, unless my clumsy fingers, 224. So is it 234 or 224? Oh, shoot.
234-265-203.
Hang on. Sorry. I managed to erase the whole thing and trying to erase a number. Okay, again, 234.
234-265-203.
234-265-203.
Correct.
Oh shoot, and I erased the number too. Damn.
It has been sent to them.
It has,
been
yes.
sent to them.
Okay.
Sorry, for clarification, has this been sent to Mayor Thompson as well? Or is he back on the call?
Yes. Staff, can we confirm it's been sent to Mayor Thompson?
Yes, it has.
Yes, it has.
Thank you.
Madam Clerk, I'm in your charge. No? I can advise Councillor Fonseca has chimed in. It has been sent to Councillor DeMarilla and to Mayor Thompson as well.
All of the information to reconnect has been provided.
So, Madam Clerk, will you start with the vote? And when we get to the end, perhaps we'll double back one last time. That'll give them an extra 3 or 4 minutes as well. Okay. Can you proceed with the vote?
Thank you. So this is the challenge. The chair voted against.
Who is that?
Councillor Fonseca.
Sorry, this is Chris.
Good.
Fonseca.
I've just got Chris, stay tight. Madam Clerk, I have a message from Councillor Deepica DeMarilla. She cannot get back on.
All of what you're saying, but I think I got the gist of it. So in terms of the...
I don't know who's speaking. Who's speaking?
When we need to look at evacuations.
Who's being evacuated?
I'm sorry, I don't know who that is.
No, that's some open line, Bonnie. That's not here.
Okay, Councillor DeMarilla says she cannot get back on and would like to participate in this vote. So how would you like to proceed, please?
What I'm going to do, Madam Mayor, is I'm going to start with the vote, and we will come back to Councillor DeMarilla once we get to the end to see where we stand then.
But she can't get back on. She's trying.
But I can't wait here all afternoon either, and the clerk has got to proceed, but we will try to manage it accordingly, Madam Clerk.
I hear something.
Excuse me. How about Councillor DeMarilla just phones the clerk's cell Come on.
Yeah, agreed, Carolyn. In truth, Carolyn, I was going to go around and see how the vote shook down and whether her vote was needed, to be blunt with you. So, Madam Clerk, why don't you proceed with the vote?
Going to suggest that she email council at
Yes.
peelregion.ca with her vote.
With her vote. Very good. Madam Clerk.
So on challenge the chair, a vote in favor supports the chair's ruling that the motion would be heard the next council. Mayor Brown?
Yes, I support the chair.
Mayor Brown in favor. Councillor Carlson?
No.
Councillor Carlson opposed. Mayor Crombie?
No.
Mayor Crombie opposed. Councillor Demurla? We'll wait for her to email back. Councillor Dasco?
No.
Councillor Dasco opposed. Councillor Dillon?
Support the chair.
Councillor Dillon in favor. Councillor Downey?
In favor of the chair.
Councillor Downey in favor. Councillor Fonseca?
No.
Councillor Fonseca opposed. Councillor Fortini?
No.
Councillor Fortini opposed. Councillor Groves?
No.
Councillor Groves opposed. Councillor Innes?
In support of the chair.
Councillor Innes in favor. Councillor Kovac?
No.
Councillor Kovac opposed. Councillor Mahoney?
No.
Councillor Mahoney opposed. Councillor McFadden?
No.
Councillor McFadden opposed. Councillor Medeiros?
No.
Councillor Medeiros opposed. Councillor Paleshi?
In support of the chair.
Councillor Paleshi in favor. Councillor Parrish?
No.
Councillor Parrish opposed. Councillor Raz?
No.
Councillor Raz opposed. Councillor Sato?
No.
Councillor Sato opposed. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor.
Councillor Sinclair in favor. Councillor Starr? Councillor Starr?
No.
Councillor Starr opposed. Mayor Thompson?
Support the chair.
Mayor Thompson in favor. Councillor Vicente?
No, thank you.
Councillor Vicente opposed. Councillor Demurla? We have not received any call or email.
She's saying, it's Mayor Crombie. She's just saying that IT is helping her now. I've just asked her to email you at council@Peel Region, so just let's give her a second. She's only just getting this message. Just as soon as you said I haven't heard from her, she texted me at that precise moment and said, IT is trying to help. And I said, could you please email your vote, council@peelregion.ca. I assume that's the right email address. Please check if it's come in. I don't think we should be penalized because she's doing valiant efforts here to come in.
Is it possible to do a count?
Perhaps.
Her vote isn't necessary
If
to
I
call
can,
the
yes,
vote.
to keep us moving along, the vote will clearly fail. The noes have it. So with respect to Councillor Demurla, the ruling of the chair has been overturned, and I'm happy to accept the motion if that keeps us moving. Does anybody disagree with that? Okay. If not, then Councillor Groves, I come back to you. Do you have a motion before the chair?
Thank you, Mr. Chair. And so my motion will be that we ask the province to delete option number 6 from the PZ mapping, and also reinforce that regional council supports the 2006 growth plan with respect to our appeal in Roper 30.
Very good. We're crafting the words to your satisfaction. Do I have a seconder for that motion?
Parrish.
Councillor Parrish has agreed to second that motion. I just want to be clear on the words that the clerk will read back before I open it up to debate or discussion and then call the vote. Just give us one moment, please. And while the staff is doing that to finalize the wording, of record, Councillor DeMerla did phone in and was recorded as opposed on that vote as well. Councillor Innes, I see you on my list as they're crafting the motion. Would you like to speak now?
Yeah, you do it, Innes.
Sure. I want to go on record in saying that I can't remember which order the two parts come in. The one with regards to following the 2006, that's obviously going to be Peel Council's decision. Given their position moving forward. However, I disagree with voting on employment lands without actually having a public meeting to discuss that. I think that our residents and our businesses, in particular both in Brampton and in Caledon, deserve an opportunity to have and be part of that conversation and to have their voices heard. And I'm disappointed that that won't be moving to a notice of motion, given the fact that we have time. Earlier in this council meeting, we chose not to discuss a development issue in regards to Mayfield West because it wasn't a COVID-related emergency matter. This too is not a COVID-related emergency matter, and yet here we are discussing it. It's a double standard, and it's showing that this council has its priorities for one development over other developments, and it doesn't matter which municipality it's in. So I'm disappointed. I will not be supporting the motion for that purpose, and I look forward to hearing back from the province in response to this request.
I will carry on, unless my staff, have you got the wording ready to go? I'm going to provide the wording now so we can speak to the motion itself. Then my list is Groves, Crombie. To staff, if you can provide us with the wording, please, just to be clear of what we're speaking to. And they're just walking it over to me. So the motion before me, duly moved by Councillor Groves and Parrish, reads that the regional chair write to the Minister of Municipal Affairs and Housing to request that the Option 6 lands be removed from the provincially significant employment zone mapping, and further that the letter convey regional council support for the 2006 growth plan with respect to ROPA 30. Councillor Groves, does that have it?
Thank you, Mr. Chair. Yes, it does.
Okay, very good. Now you're on my list to speak to the motion. Go ahead.
Thank you, Mr. Chair. And I just want to make the point that this motion is brought forward as a result of business that arose from an in-camera, if I can say that, and it does relate to business that we had listed on our agenda, whether it be in camera or open session. So, and I'm happy to send that. And I think that the province, they did come out with mapping, said that they did consult, and so I have no problems in sending this to the province, that this is our position at the Region Appeal.
Thank you. Further speakers to the motion? Mayor Crombie.
Thank you, Mr. Chair. So I disagree that this is a double standard because this was already on the agenda, and we had already voted on the Mayfield land and asked already that be included in the total MCR in the comprehensive municipal review. So there's not a double standard here at all. And in the words of Councillor Downey, these conversations are happening whether we like it or not, and there are councillors on this council that are perhaps putting forward positions that may or may not be contrary to our own. We spent 4 years debating where residential land should be placed. That should be respected, not only by this council, and frankly, that we don't need to have another discussion about employment lands. We're not talking about that right now. This is where we're reinforcing where where the residential lands are going, and that was a hard-fought, long debated, long discussed over a 4-year period, and we're not going to allow the provincial government, through a motion by a minister, to supersede our vote. I mean, why bother having these discussions and putting forward these positions if they're going to come in with a stroke of a pen and through an MZO or something like that, contradict us? It's not democratic. So we have to stay firm that these are decisions this council has made in the past, and we want to put forward that position to the minister and say, you can't do this. We won't let you get away with it. Sorry, these are residential lands. This was something that we came together on almost unanimously. I think 70% of this council, 80% of this council voted in favor at the end of the day. So that's our position. We don't need to reopen it. We know our position. And so now we're voting to clarify that with the minister, that we don't agree that employment should even be considered in that area. Thank you very much.
Thank you, Mayor Crombie. Our solicitors come onto my list. Patrick, do you have a final comment before I have the clerk take the vote?
Yes, thank you, Mr. Chair. My suggestion would be that the second part of the motion dealing with the applicability of the 2006 growth plan, that you consider not having that second part. The reason for that suggestion is that, as Mr. D'Agostino has advised, that very position is part of his motion. It is sitting as we speak before the LPAT, which is a quasi-judicial proceeding, and they will make a decision. Council's preference on that is being advocated strongly by Mr. D'Agostino in those proceedings. It would be, in my view, potentially counterproductive for the council as a political body to attempt to advance that in a communication to the minister and other political official when it's sitting before something akin to a court for decision making.
Okay, I'm going to go to the mover of the motion. Annette, are you satisfied with that?
Yes, I am, Mr. Chair.
Okay, thank you. That being the case, for the Councillor Parrish, are you satisfied with that as well as the seconder of the motion?
This damn system went down again. I just got back on. Could Patrick please repeat it?
Yeah, absolutely, Carolyn. Patrick, go ahead for Councillor Parrish.
Yes, I'm just suggesting that the second part of the motion requesting to the minister that the 2006 growth plan apply, it's inadvisable to have that at this time in this motion, not because it's not council's preference, but because Mr. D'Agostino is advocating that very position in a quasi-judicial proceeding at the LPAT, and a communication from one political body to another political authority on a matter that's sitting before a court-like body like LPAT is not advisable in these circumstances.
That makes perfect sense, Patrick. You're batting 99 out of 100.
Thank you, Carolyn. The mover and the seconder agrees that it is redundant and it is the position that we have going forward through Mr. D'Agostino. So very good. Having said that, my list carries on. Councillor Sinclair, Mayor Brown. Councillor Sinclair.
Yes, thank you. From my position, and I wasn't around on council for the thorough debates previous council, where I did attend many of the public information meetings held by the town on the whole BREZ expansion. And I noticed that no one's mentioned the provincial's GTA West corridor and the shift of a major cloverleaf right into the subject area of option 6. And I suggest it's very poor planning to put residential smack in around heavy truck routes and a major arterial highway. So I think, frankly, events have overtaken the whole BREZ decision-making process. So I won't be supporting the motion. Thank you.
Thank you, Mayor Brown.
Well, I think we've all said our comments on this already, but since Mayor Crombie expressed her comments, I will do so as well. From a Brantford perspective, First of all, I can't vote for anything that diminishes employment lands. We desperately need more employment lands in Brampton and anywhere in Peel region. And secondly, I don't understand why a development issue is pressing right now when we have COVID-19. I know I've got lots of activities today that I'm delaying that work with the hospital because this meeting continues to go on, and I hope that in future matters like this we can we can deal with after this pandemic is over. So it's rather frustrating. We're still dealing with this, but so be it.
Thank you, Councillor Parrish.
Yes, thank you. To Councillor Sinclair, whom I respect greatly, if you go to 401 and Mississauga Road, you can watch houses and all kinds of other things backing right up to highways. We've got them down in Lorne Park. We've got them over in Port Credit. That's the way a city grows, and I don't think that's going to stop it. It's something that big cities cope with, and eventually Caledon will have to cope with. And to Patrick Brown, when you can't win, you delay. That works in law and it works in politics. And I think we just go ahead with this vote. Thank you.
That exhausts my list. Madam Clerk, over to you for the vote.
The motion moved by Councillor Grove, seconded by Councillor Parrish, that the regional chair write to the Minister of Municipal Affairs and Housing to request that the option 6 lands be removed from the provincially significant employment.
Madam Clerk, the mover has now been kicked out of the system. This is, the system is just not working. The mover is off.
Councillor Groves?
Yes, Councillor Groves.
Okay, we'll come around and Bonnie will deal with it when we get to her. Let's ensure
You
that
can't have a vote. She's the mover,
Yeah.
unless I'll move it in her absence. But she's just texted me, Mayor Crombie, please let them know I'm out.
Okay, let's give her simply because she's the
Mayor
mover. I agree,
Crombie,
Bonnie.
the system indicates that she is not out, that she is in the meeting. So we'll just give her a second to unmute her mic.
And Bonnie, we're giving it a moment. You're right, as the mover of the motion.
Hello?
Oh, there we are, Annette. Good.
Thank you,
Okay, Madam
Councillor
Clerk, carry on.
Skype kicked me out.
I will reread the motion moved by Councillor Groves, seconded by Councillor Parrish, that the regional chair write to the Minister of Municipal Affairs and Housing to request that the option 6 lands be removed from the provincially significant employment zone mapping. Mayor Brown?
No.
Mayor Brown opposed. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
Yes.
Mayor Crombie in favor. Councillor Demurla?
Councillor Demurla emailed in her vote.
Okay, we'll carry.
Thank you.
Thank you, Bonnie. We'll take it as such and move along.
Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
Not in favor.
Councillor Dillon opposed. Councillor Downey?
Not in favor.
Councillor Downey opposed. Councillor Fonseca?
Yes.
Councillor Fonseca in favor. Councillor Fortini?
Yes.
Councillor Fortini in favor. Councillor Groves?
Yes, in favor.
Councillor Groves in favor. Councillor Innes?
Opposed.
Councillor Innes opposed. Councillor Kovac?
Yes.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
Yes.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
Not in favor.
Councillor Paleshi opposed. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
Opposed.
Councillor Sinclair opposed. Councillor Starr?
In favor.
Councillor Starr in favor. Mayor Thompson? Mayor Thompson?
No.
Mayor Thompson opposed. Councillor Vicente?
In favor, thank you.
Councillor Vicente in favor. Councillor Demurla emailed in favor. Councillor Demurla in favor. Motion carries.
The motion carries. Okay, with that, Madam Clerk, the last item I have before the chair, I believe, is a motion moved by Councillor Sinclair, seconded by Councillor Kovac, that the April 9, 2020 Regional Council meeting be adjourned. I'm assuming all in favor. Is anyone opposed? If not, that is carried with thanks to all.